Hello.
Hello, can anyone hear me?
Yes. Hello. 代号是不是3还是4
？3、4是公主，4是那个 Spanish 的，
所以我需要写3，对不对？我是志公主的话，
是，可是我不晓得去哪边报道啊。
就是找不到。
志公主是4，
那为什么上面那个 Zoom 上面是写3？
对呀，他今天又写
没有号码在后面
啊，
号码在
号码在后面。
OK，好，那请
It's very confusing， 但
那美国的代码要写几号？
没有美国，这里只有是美国的，全部是美国的。
那我们最头上的那个号码要写几？那个 T 的前面，后面写 4， 让
没有字
T 的前。
你的 T 是保持 T 的哈，那只前面的号码是根据你等一下要参加分组讨论。
你要是中医就是2，中医组就选2，然后其他组
中医组是3，中医组是3。
不对啊，我这个
可不可以有人确定一下前面的号码是什么，后面的号码是什么，好吗？感恩，不然我们很 confused。我们的 team number 是在后面，在 T 的前面还是后面？
你现在说的 team 是等一下分组讨论的 team， 还是你现在的 team？
OK， 第一个号码是看你要进入哪一组，如果是西医就是
可是我
美秋师姐还没开始哦。
可是他们不是已经在手语了啊？已经在演手语了啊？
那是在练习吧？
应该在练习啦。
我们是15分开始的。
Thank you to the sign language. The chat room to ask our backstage team. Thank you. Moving next, we are going to start our first program, the FQAC workshop. Please welcome the CEO of the Buddhist Tzu Chi Medical Foundation, Brother Kevin Wong.
Hello, everyone. Welcome to our morning session today. Thank you for joining us bright and early. We're happy to have you on board. We have a great panel here today for everyone to ask questions in a bit here. But in the meantime, we're going to go through a small presentation first. My name is Kevin. I will be the host today for this particular session. So what we're going to do right now is I'm going to go through my slides here first. So just see. Perfect. So a lot of you may be interested in learning a little bit more about our FQHC lookalike status. We've gotten a lot of inquiries from various folks on the line here. And I will be going into a little bit of an intro first, and then we're going to go into the roundtable where you're going to have an opportunity to ask some questions. When we first looked at the FQHC program, it's going back more than 3 years now. And Dr. K decided that that would be the path the Medical Foundation would take. And certainly it was after 3.5 years of hard work and preparations that we're able to now be able to be designated. And when we talk about the designation, one of the top questions that we get is, what is a lookalike? A lot of times we talk about FQHC. What's an FQHC lookalike? So I'll be going through that a little bit here in the morning. I'm going to talk about the needs assessment that identifies if your area will have a need for an FQHC or an FQHC lookalike clinic. And then we're going to go into more in-depth as to how the FQHC lookalike program has affected or influenced the Medical Foundation's operations. So when we look at the FQHC and the lookalike program, this is essentially the difference. Under a fully designated health center, you can see here one of the major things is having coverage under Tort Claims Act, having federal loan guarantees for capital improvements. Those are things that you don't really see as a lookalike. Now, what's interesting is since those are the major differences, what has actually happened during the pandemic, or I should say just post-pandemic world, is that some of those things are being extended to lookalikes as well, because now there is an increasing recognition that lookalikes do pretty much everything an FQHC does, except that there are a lot of lookalikes. There are also a lot of FQs. And to open up what we call access point applications, they actually take time and takes a different form of evaluation as well. So, for example, even though we don't qualify for federal grants as a lookalike under Section 330, one of the things that's been changing during the pandemic, or I should say post-pandemic more or less, are some of the grants are being made available for lookalikes as well. Even though they're not as high of an amount, what's happened is that there are some subsidies, sometimes in the amount about 50%, let's say, that would apply to lookalikes as it would for FQs. So it has been an interesting development in the post-pandemic world. How this would transform will really depend on the budgets available for the government and also depend on the kind of services the FQHCs or lookalikes will continue to provide. Keep in mind, around the whole country today, there's about 105 lookalikes, plus minus. And those figures are still quite substantial. So lookalikes have been really pushing for some of these areas to be extended to lookalikes as well, such as capital improvements. So those will be interesting developments that we continue to see in the post-pandemic world. And when we talk about the need, it is interesting to firstly understand how the whole healthcare system currently breaks down to. FQHCs are established in the areas that are considered to have the need for that particular service. And when we look at the entire market itself, as this slide would show, is the whole population right now is about 300 30 or so in population. And when we look at how it breaks down, you can see that it breaks down to 3 main categories. And these categories essentially show how the population currently look. So we have Medicare being one major areas for people age 65 and above. And then those that are below age 65 and non-military, you can see that that's the majority of the population. And the breakdown of those translates to about 159 being covered by employer base. So employer base would be plans, for example, that CG would offer its employees for as an example. And then other coverage is where it breaks down to the different Medicaid programs. So for us to really be able to make use of that other coverage portion, at least for some of those areas, you can see very clearly here that you have to have a need before the government grants you the designation. So what is actually a need? So if we look at our LA County region here today, this is part of our application to getting our federal designation. You will see where the plus signs are, that's where our clinics are located. And the colors, the red pieces, show that the poverty rates are actually a lot higher. So where we actually operate, we're in regions where poverty levels are actually high. Those will be poverty levels about 20% or higher. Now, does that actually mean one way or another that you would be designated for sure? No, of course not. There are a lot of factors that go into the designation, but poverty levels is one of the most important, because what we're really talking about here are federal or state-based assistance programs, which FQHCs are really geared up to target. That's why for our reimbursements for the fees, or I should say costs of delivering healthcare, is exactly why we want to operate in these areas. As you can see, the opportunity to continue to grow and to continue to serve more people, it's certainly there. In fact, there are a lot of areas outside of our current service territory that you can tell has additional needs as well. So this chart illustrates even better as to where things are at. So if we look at the federal poverty guidelines, now keep in mind the federal poverty guidelines are actually quite low. For one person, we determine it based on family size, we determine based on income. The actual minimum wage, if you have a minimum wage job, that would essentially put you over the 200% federal poverty guidelines. So being within the 100% means that you're not really working full-time at all. So there are people that can't, there are people that are struggling as well to find a position that would pay even minimum wage. So in the territories that we actually service right now, based on our permanent clinics, you can tell below 100% means that they're not actually making that $10,000 for a person, one household family. You're looking at about 310,000 people, and which means that our service percentage as a percentage of the total population is about 14%. In the whole LA County, the average is actually about 17%. So you can see that there's actually a lot of poverty in the areas that we currently serve right now, as well as areas that we currently don't serve. So the opportunity certainly is there, and there's a need for this type of healthcare providing setting, which the FQHCs certainly cater to. And this particular chart here tells you a little bit of a breakdown as to what kind of salary, what kind of income there are in the current areas. So combined with these factors is where the assessment, the need assessment really happens. Now, when we look at expanding across the US or even across California, these will be key statistics that we need to examine to ensure that we're putting locations where there is an obvious need for an FQHC or FQHC lookalike center. Now, in addition to just income, poverty rates, as well as household size, there are a lot of metrics that prompt the needs as well. And if we look at a combination of those needs, which is based on income as well as their health status, you can tell here that a lot of distribution, let's put it that way, that low income numbers and fair and poor health status is actually about 25.8% in the areas that we currently serve. So it is certainly higher in where we are right now than the LA County average or even California average. So when we look at those that assess their own health conditions as fair or poor, with amongst low income earners, that is a large percentage. Now, aside from just the cross section between health and income, there is also an importance that we need to determine, which is the kind of diseases or chronic illnesses that people may have. And these precise measures are the measures that government wants or HRSA wants health centers to focus on. There are 18 measures. Now, I'm not going to be able to go through all 18 measures, but certainly want you to be aware as to where these measures are. So if we look at, for example, heart disease and hypertension, our percentages are actually quite high as well compared to the county as well as the state itself. So we look at ever diagnosed. This is someone that a patient that's ever been diagnosed with heart failure, congestive heart failure. In where we are right now, there's about 34,000. That's among low income earners. Keep in mind, this program, because we service mostly state-based, in California's case, Medi-Cal, that coverage is only up to a certain percentage of the federal poverty guidelines. That's why a lot of the references are towards low-income earners. So those that's ever been diagnosed with high blood pressure, per se, in our service area, there's actually about 319,000 of them, which accounts for 32% of low-income earners. So these are stats that one would need to evaluate to see where we are, our service territories, are they suitable for a health center? So this is based on health, heart disease and hypertension. There's tobacco use, which is, again, one of the 18 measures that health centers need to try to improve once they acquire these patients in the local areas. There's also obesity being a really important area. And as you can see, a lot of people are actually 18 or older and obese in the low-income population. And that accounts for 2/3, actually, of the low-income earners. Cultural sensitivity also being an important one. One of the advantages, obviously, with Tzu Chi, especially with our health centers right now, is that we're able to deliver healthcare in 3 different languages. For example, we have Chinese, we have English, obviously, as well as Spanish. So in the preparation work of this, you can tell, not aside from understanding needs, we have to determine what do we do to accommodate these patients that are of low income. So one of the things that we do is something called a sliding fee scale. A sliding fee scale is something that you have to implement as a health center. When I mentioned income being low, let's take a look at the very left column here. It says at or below 100%. So at or below 100% for a family size of 1 person, meaning that this person doesn't have any other dependents, for example, you're looking at an annual income no higher than $12,880. That is a very low income. If you made the minimum wage in California right now, in fact, you would be well over the 200% threshold, which means that you would actually not even qualify for the sliding fee scale. So as you can see, the catering of the patient group here is specific to low-income earners, especially if their family size is anything more than 1 as well. So in the preparation of this, there's actually a lot of work. The entire team was mobilized. As you can see on the picture here, there's study groups that we formed involving most of our staff members. we're very happy that we have great volunteers that helped us out as well to prepare for the different, it's almost like examinations, for lack of better words, for HRSA to come and inspect what we have prepared and if we're ready as a health center. So not only are we involved as staff members, our board members are very involved as well. And you can see here our board members are having study sessions as well as an interview actually over lunchtime that HRSA conducts. So that is the amount of preparation work that went in just even for that one 3-day visit. So talking about the 3-day visit, a lot of you may know the current team very well, but one person you may not know very well is our CFO, John Panzerande. He came to us with more than 20 years of experience and was a crucial part of getting our designation as well. So let's watch a brief video of not only what our health centers are doing, but as part of that, also pushing vegetarianism.
Hello, hi, my name is John Panzerande. Hello, Master Chen. I've been involved with tNTVY for about 3 months. It is truly an amazing organization. I came here to help out with the fiscal, with the finances, so we can pass the site visit. I've been with tNTVY for about 4 or 5 months. I work with other health centers for about 10 of them. This is truly an amazing organization. I've learned about vegetarian meals. I've learned about spirituality. I've learned about kindness. Great organization, and the service you do to the community is just amazing. We just finished with the auditors, and they were just amazed at all the charitable work that we do. So I feel blessed that God put me in this situation to be able to meet all the staff, to first to get to know the tNTVY organization and the great work you do internationally, and then with all the board members, with Dr. Chair, with his lovely wife, and all the other volunteers here. I think the site visit went very well. I've been doing this, like I said, for a good 20 years. I've been in several health centers, but I feel the spirit here. I feel God's spirit here. And God's definitely was helping us. So I just wanted to express my thanks to Dr. Kidd for allowing me to be part of the organization. And thank you for tNTVY for teaching me vegetarianism. I've been eating vegetarian meal for 3 days now. I feel so much better. So thank you very much. Thank you. Hello, hi.
So John was a really integral part of us getting the designation. And as you can see here, we're officially certified from November 1st of last year. It will be through to 2022, which we renew. It's always a several year period, but we have annual certification periods as well. So that's where we are at. It's been a long journey, and I think to those that's been involved, we'll all agree that it was not an easy journey, but certainly one that I think we can look back on and be very happy as to where it brought us. And we want to see that through to additional areas of the US as well. And hopefully we'll be able to accomplish that by today's session. We hope to be able to answer a lot of your questions. We hope to be able to explain to you a lot more about what FQAC designation actually means, and be able to also share with you some of our operating nuances when it comes to our health centers. So I'm just going to ask those online to please mute yourself if you're not speaking, so that way we have less interference on the line. Now, I'm going to take a moment to introduce to you all, and I'm sure these are familiar faces, our roundtable group. We have obviously myself as moderator. We have a great panel of our medical foundation representatives. We have Dr. K. Dr. K is currently the chairperson of the board of Medical Foundation. We have Dr. Stephen Dang. Dr. Dang is currently the CEO of the Medical Foundation. And we also have Dr. Julie Lam. Dr. Lam currently is our Chief Medical Officer for the Health Center. So we also have a number of guests, areas where they've been very interested in potentially looking at having health centers in the region. Please join me also to welcome Dr. Kenny Liao. We have Chong Shea Sibo and also Minjing Sibo as well. So CEOs of their respective regions, and certainly very happy to welcome everyone. So our panelists, please do turn on your camera. I think our group here, media team here would show everybody as a panel, so that way we can see everyone.
Hello, everyone.
Thank you.
Hello, so, Leo from New York. Thank you.
Hi there. Hi, thank you. Thank you all for joining us. We have a first question that was posed and sent to me earlier, which is, what really is an FQHC? You know, even though what I've just said, it's still sometimes puzzling, but let's invite Dr. K to tell us in more easier to understand way as to what really is an FQHC and what it means to be one. Dr. K?
I feel very grateful. Kevin gave a general pictures of FQHC. Basically, what is FQHC? It has to be a community-based healthcare providers, and also it should receive funds from HRSA Health Center program, and also provide primary care service in underserved areas. People may ask, what is HRSA? HRSA means Health Resources and Service Administration. Okay, that's the answer.
Perfect. Thank you, Dr. K. And I think that's a great answer. Actually, I never really thought about sharing about what HRSA stands for, but that's exactly it. That is exactly it. We're here to deliver services to the local community, and especially in the communities that we work and potentially even live in. I know when we talk about providing care sort of locally, we have family in those areas too, and delivering good healthcare really does mean a lot. And I know we even have our physicians, choosing to be physicians because, they want to improve the healthcare in their own communities. So it is more than just being a health center. It's also the physicians that we have in the health centers ourselves. So the next question that I have received as well in advance was, what are the benefits of being FQHC? We talked a lot about serving the community. We talked a lot about what it means to be an FQHC and what it stands for. What is it in there that it is beneficial to actually being a health center? Dr. Deng, would you like to take that question for us?
Sure. Good morning and good evening or good night from Taiwan. I'm currently in Taiwan. The benefits of being an FQHC, probably most people will look at it in short, will be able to get funding from the federal level. So Kevin has already shared some of the benefits. But from a health center perspective, after all, FQHC is a health center. It's a federal qualified health center. The most benefit is actually allowing us to provide better services for the community. And it's not just a community by itself, but we are also targeting a very specific group, and that is the very underprivileged or low income level population, and which was explained earlier with the sliding scale. So utilizing this sliding scale, it allowed us to focus on truly the needed population. So Master has always taught us 借力使力, so I would translate it as ride along with the waves. So because we have been serving this population, and now we are able to obtain the extra or additional benefits, or even more clearly, financial benefits from federal, so certainly that would be a most direct benefits. But being a physician, I think the true benefit is for the fact that to be a federal qualified health center, we have to provide much better and more well-rounded services for all our patients, and which is indeed something that we were not able to do running the free clinic, for example. And looking back at the history, I kind of see the similar pattern. Remember how Master started it out with a free clinic in Hualien, 在仁爱街, the very first clinic, which she did share with us as well during this Tima convention, and how we end up having a hospital. It is for the fact that she realized running a free clinic is not providing enough benefits, and now the benefits is for the patients, not for being an FQAC, for the patients. And she therefore lead us to build a hospital in Hualien. So similarly, I think in the United States is that we have been running a free clinic for so long. And I think becoming an FQAC is one step more because we are now able to do more as an outpatient. We are not a hospital. Maybe in the future, that's one of the things that our board would like us to work on. But for the time being, we do what we can as a health center. And so benefits is numerous, but what I've just shared with you all are simple ways of knowing and understanding why we are working and now a FQAC lookalike.
Great. Thank you, Dr. Dang. I think...
Kevin?
Yes, Dr. K, would you like to add something?
Yes, I would like to add on something. Before I add on something, because there are a few guests in the panel, in the round table, so maybe we should ask our guests raise the question. And what I would like to add is FQAC financially have a lot of benefit. It is a enhanced Medicare and Medicaid reimbursement, which is called PPS, Prospective Payment System Reimbursement for Medicaid patient. In California, we call Medi-Cal, and also cost-based reimbursement for services and to Medi-Cal patient. For 65 above patient. So financially it's good for health center. And also we can apply grant from federal. Thank you.
Thank you, Dr. K. Yeah, certainly the financial benefits of us being able to further our mission, like Dr. Deb mentioned, is an important reason as to why being a health center could be a good choice. Whether it is for your regions or for just being able to reach out to the low-income population even better. So those are major differences. And before we were designated to see Medi-Cal patients, our proceeds would be a fraction of what we receive now. Certainly, you're looking at about several multiples more. And that allows us to build up a practice, allows us to hire good people to join us. So those are things that really would help the overall operations of health center. I see that Dr. Liao, you have a question, Dr. Liao. Please go ahead.
Yes. Good morning, good evening, good night to everyone online. This is Dr. Liao, the Director of Medical Development and the head of the Medical Committee from the New York chapter This is going to be a preempt question as I'm going to ask the question later, but let me ask at this point, I think it's pertinent. So this is a collective question from many of the areas and branches of the Tima that I spoke to. So being that said, the benefits of being an FQSC. So what are the actual extended benefits of being an FQSC to the rest of the regions, chapters in the United States? For example, in New York, we are trying to, and in the process of hopefully in December, to set up a Tzu Chi New York community health clinic in New York, and hopefully in the near future, when the affinity is right, that we'll be able to branch or be licensed to have the extended FQHC, hopefully in 2 years or so, to the New York or the other areas. So my question is, what are the extended benefits and how the rest of the regions can benefit? And also, my last question was, what are the logistics of, I know this is a premature question, of being able to be qualified as part of the FQSC branch or license to do practice in other regions of the United States. Thank you.
Thank you, Dr. Liao. Thank you for your question. I think as a health center and being able to have taken those 3.5 years to get the designation certainly should help us expand into other regions as well. And for this particular question, why don't we ask Dr. K to start, and then maybe Dr. Dan can add to that as well. Dr. K.
Yes, it's a very important question. A lot of Tzu Chi people in other areas, in other states, all have this kind of question. First, being a FQSC lookalike right now, because we have been passing through the process, so we know about the logistic, how to apply, and also the process of application. So that's the benefit. And also, we have a team in California, which it's also a good benefit for us to move forward in other areas, although we still need outside consultant to help. That's second benefit. But in local side, like in New York, or Chicago, or Northern California, you need to have people in place and also budget ready to run. That's my advice. Thank you.
Thank you, Dr. K. Dr. Dan, would you like to add something to that as well?
Sure. Benefits is numerous, but I think it's generally put is that having a health center in various regions, just like as what we have now in Southern California, always provides a very strong, call it a root of our medical mission. And we do medical missions nationwide. And for those areas that are able to have a health center in place, certainly will be able to assist in the medical operations or in our medical mission. The health center allowed us to raise, as I mentioned earlier, allow us to be able to do a lot more for our patients. There's only so much we can do when we do medical outreach. There are always going to be cases that can potentially refer back to our clinic for additional services. And that is something that we will be able to do. Staffing-wise, having a health center also means we have strong providers available so that in any medical missions, if we need extra providers to help out, certainly the medical foundation can assist that as well. So with a Tima operation, or almost any type of Tima operation, we will be able to provide some assistance. And I think to have FQAC in various regions certainly is one of the future goals that we are trying to do, and we are more than happy to see it happen. So there's a lot more, but I think overall is to be able to raise our ability to serve in all the areas that have a health center.
Thank you, Dr. Deng. Thank you, Dr. K. I think certainly with the amount of inquiries we've gotten, especially after we've received designation, it has been very interesting because we were able to sort of see a little bit as to where the interests are coming from. And we're pretty excited that, the road is sort of being paved as we speak to really build this potential medical mission across the whole country. So thank you, Dr. Liao, for your question. Dr. Liao, I see you're unmuted. Do you have a follow-up question to that?
Yes, if I may, then I want to give the question to the rest of the guests. My second question is, the FQSC, the way that I know FQSC look alike, is basically set up to serve the underserved, meaning the documented and the underinsured population. As our master tells us that we have to help people who are really in need. Those are the population pocket that are either undocumented or uninsured, which is what we have a lot in the New York, I'm sure in other regions of the United States too. So how would that work hand in hand with the FQSC? Would that be a conflict, or are we underserving those pockets, the undocumented and the uninsured pocket of population? How do we strike a balance between the FQSC? We have a lot to learn, especially we are taking the baby steps. Like Dr. Dan mentioned, actually New York is only like the free clinic we are starting now, other than we have the 2 mobile vans, the mobile dental units, thanks to the Tzu Medical Foundation and Dr. Ger's effort to provide us those 2 services. So we really like to see how we can be able to learn from your 10 years of experiences in California, so that we'll be able to take a quick step in establishing what we would like to be one day, aspire to be FQSC in California. Thank you very much.
Thank you, Dr. Liao. I think your question is spot on, and we do get that question a lot because I think the best way to put it is being a health center, a federal qualified health center lookalike, it doesn't deter us from serving those that cannot afford either sliding fee scale, they don't have Medicaid programs. We continue to see them. I think that's the beauty of having the designation, is that it gives us even more bandwidth to be able to serve those communities. Without, the federal subsidies, for example, a large portion of the patients that we see right now will be actually out of pocket for many of them. And with the subsidy, it gives us the ability to have the financial means as well to serve the population that otherwise we may not be able to. And I think Dr. Deng actually put it really well. A lot of times government regulations are there to prevent people from overcharging. But Tzu as Tzu, we find a way to not have to charge. I think that's actually put really, really beautifully. And that's exactly what we are doing. And for those that come that can't, that they're uninsured, that can't afford to pay for care, we still see them. And in fact, there are a lot of cases that we waive their fees in order for us to deliver that healthcare. And since I just quoted Dr. Deng, Dr. Deng, would you like to add something to that?
Sure. Short answer would be it does not prevent us from seeing our targets for Tzu medical mission. So anyone that has a low income or uninsured certainly are our targets. Being an FQAC, the benefit, one direct benefit is that we are able to get government subsidies when we see the low income patients that has Medi-Cal. In New York would be called Medicaid. And So that is a direct benefit, but it does not take us away from what we have been doing. Now, I think the to acting as or function as a free clinic, I believe I mentioned it already earlier, is that we can only do so much. And I think that is the key. We weren't able to do as much as we are doing now. So even for uninsured patients that comes into our clinic, they in the past, if they're not able to afford, we would only do say basic services. But now these basic services has been expanded to quite greatly, I would say, so that all these uninsured patients receive additional benefits. So under or looking at the clinic operation, we will be spending a lot more on each visits because they're not able to pay. But this area has already been calculated and will become a part of the reimbursements because we're getting a whole lot more for the Medi-Cal patients that otherwise would only pay us, say, a fraction, to be more exact, only less than 10% of what we would be able to get. So this extra, quote unquote, is actually anticipated and allow us, the clinic, to be able to serve these uninsured or low-income population.
Okay. Thank you, Dr. Deng. So in the whole program, I think the intention is not for us to see less of a patient population, but being able to deliver more, especially to those that are lower income. So that certainly would not preclude anybody that's undocumented or uninsured. So hope that answered your question, Dr. Liu.
Yeah, and I'd like to add
please.
one more thing, sorry. I think Dr. Liao was asking. So we don't know exactly what the numbers would be, but we do estimate and also try to borrow experience from other existing FQACs. So what are the percentage, I'll put it that way, of type of patients that we will be seeing? We are currently looking at maybe 70% Medi-Cal or Medicaid patients and 30% cash pay. This is kind of a general idea. Is that going to be a good number so that our clinic can operate? As being able to sustain our clinic operation is also a key issue why we wanted to become an FQAC. So we don't have the exact number, but right now we are shooting at 70% Medi-Cal patients and then 30% cash. That's kind of the overall idea. Thank you.
Okay, thank you very much, Dr. Deng. And I hope we answered your question there, Dr. Liao. Thank you very much for your questions. I see that Brother Minjing has some questions as well. I see that you were raising your hand. So I would like to give the floor to you if you would like to ask a few questions.
Thank you. I just want to take along the discussion that was talking about the target population. So can the health center accept the private insurance patients?
Absolutely. Thank you for the question. Absolutely, yes, we can. And I think, like I said, it doesn't really preclude us from seeing patients that have private insurance, that's got Medicare. It's really meant for us to be able to deliver more healthcare services, if anything. And I think Dr. Deng, you wanted to add something as well. I saw that you unmuted yourself.
Well, now you answered it already. One of the general rule of being an FQAC is that we do not refuse anyone that comes into our clinic. Certainly there are so many to see, and there's only so much we can do. Therefore, we do need to prioritize, put in a priority or some kind of a list on who are our primary targets. And the ones that we have been talking about, the underserved, uninsured, low-income patients are our primary targets. And some of them may, end up to be having Medi-Cal or Medicaid, and these are target patients determined by the federal or the government. So government has already done the screening for us because these are truly the low-income population, and therefore they have become our primary targets. Commercial patients becomes a little bit more challenging because there are people that are making a decent income and they can get commercial versus somebody who is barely making enough and they are fortunate enough to get some commercial insurance, say Obamacare. Some of them may not be able to get decent services, to be honest with you, because not all insurance do have good coverage. And these are certainly also our targets. And how do we, let's say, save money for them? And that is because of the sliding scale. So for the fact that if they have commercial insurance and they are not making so much, they also qualified with this sliding scale. So sliding scale is a way allowing us to truly target and so that we don't overcharge. And I think Kevin has mentioned earlier in our Tzuji's culture, we kind of don't really need that because we are already undercharging and we have the habit of undercharging. And we have been doing so for so many years, even without charging. FQAC does not like to see us that we charge zero, speaking. But truly, for those that cannot afford to pay, we would just, kind of provide our services, and we don't stop them from seeing us just because they cannot afford to pay. So generally speaking, we will cover everyone that comes into our clinic.
Great, thank you, Dr. Deng. And I think, just Brother Meiji, just to put a little bit more perspective on your question, I think I want to ask Dr. Lam to share a little bit as well, because Dr. Lam joined us earlier this year from another health center, and she has a good panel of Medi-Cal patients along with other patients as well. I want to ask Dr. Lam to give us a bit of her perspective as to the different types of patients that she's been seeing, especially in the sort of underprivileged areas as well as commercial as well. Dr. Deng, Dr. Lam sees the most patients in our clinic, so I think I would definitely like to invite Dr. Lam to please share your perspective as well. Dr. Lam?
Hi, everyone. So basically, as Dr. Deng and Kevin has already mentioned, we do take all kinds of patients. And one of the unique things about Tzuji is the way we started in terms of, a free clinic and then later a community clinic. So the patients that we're concerned about that might be uninsured or undocumented, we are already taking care of them. Now, I've come from 2 other FQHCs, one actually very large, and those centers usually target Medicaid patients. And a lot of times our Medicaid patients are also, even though they are documented probably and have insurance, they aren't able to really access the care that they need. Now, even though there are other FQHCs in the area, the location where our clinics are, we actually serve a lot of the Asian or Chinese speaking population. And I know, for example, I worked at one of the largest FQHCs in Southern California, and I would have some Chinese speaking patients come in and they are able to get through the entire clinic without being able to speak to anyone in Chinese. And these patients don't speak any English, and some of them, can barely understand any more than a hi or a thank you. So for us at Tzuji, being, designated as an FQHC lookalike and allowing us to care for these patients as well, we are able to capture people who might not be undocumented, but actually have a strong need for culturally, competent care, and really being able to access, the call center or front desk or back office staff who can actually communicate with them. So I think it's a combination of everything. And then, of course, everything else is still fairly similar. Like we will see you if you have no insurance. We will see you if you have the best commercial insurance. We will see everyone in between. But our target and what the federal government would like us to do is focus on the patients who do have Medicaid and have trouble accessing quality care.
Thank you, Dr. Lam. I think Dr. Lam brought up a really good point in the sense that, in terms of delivering the care that we're looking to deliver, a lot of times it's more than just sort of the group of patients that would just see us, but the kind of availability we have in the services that we provide in different languages. So I think, what I mentioned earlier in one of my slides, in terms of the ethnic breakdowns, that is also important to consider in terms of evaluating needs in your particular area. Brother Meiji, did that answer your question?
Oh yeah, thank you. Thanks a lot. Yeah.
Thank you. So I see that we have a number of other questions as well. I'm just going to go to them. In terms of, we have Brother Jonathan asking, in terms of multi-specialty services, do we refer in-house or outside to specialists? That's actually a really good question. As part of our application to become designated, we needed to submit something called Form 5A. And what that form actually has is a list of services that we can provide in-house. It's a list of services that we have to refer out, and a list of services that we contract. So those are areas that we need to very clearly state to HRSA. And one of the things that they discourage is basically having specialization in just one area. That's something that they don't want to see. They want to see us being able to see as many patients in our community as possible through the whole bunch of different types of services. And in fact, we know of other health centers that's tried to go for a designation, but they're specialized in just one area. And unfortunately, they weren't able to obtain that kind of designation. So being diversified just enough is important. So in our health centers right now, we currently offer medical, we offer dental, vision, as well as acupuncture services. And within those, we have certain treatments that we take care of in-house instead of just referring everybody out. Now, of course, there's services that we need to rely on others as well. But I think, it's a good example to have general primary care being the forefront as opposed to one particular specialization only. And with that, Dr. K, would you like to share a few things? I know you looked into the market pretty substantially before we even prepared. So would you like to share a few words?
Yes, actually, it's all depend on what are the patients you're seeing. For instance, right now, because a lot of patients need vision care, so we can hire optometrists to provide vision care. And if we see a lot of chronic pain patients, we can hire either physical therapists or acupuncturists to do acupuncture therapy. So if we have more diabetes, then we may consider to hire an endocrinologist and do not refer out. So for multi-specialty care, most of the time we are going to refer out instead of stay in, unless we have a lot of patients need this kind of service, we can provide in-house. That's my thinking. Thank you.
Thank you, Dr. K. I think that's exactly it. And when we talked about the patient population breakdown earlier as part of our application, you really get a sense as to what the needs are in your local community. And where we are right now, there's when I showed earlier about smoking, obesity, talking about heart diseases. Those are areas that you can tell they're elevated in the areas that we serve compared to the averages of the county, of the state as well. So understanding your market is going to be very important to determining what kind of specialization you may want to have in-house or those that you refer out. So thank you, Dr. K. So I want to invite Brother Shay from Chicago. I know you're online as well. I haven't had a chance to ask any questions yet. So please, thank you for joining us today. Brother Shay, do you have any questions for us?
Yes. Thank you so much. I think this is a real good session. And so I understand to be a FQHC, you got to be a health center, right? It cannot be a health center if you're just a free clinic. So I'm just wondering what to move from a free clinic to health center. What are the fundamental elements of health center, and what it takes to move from free clinic to health center?
Great, thank you, Brother Shay. I think it's a great question. I can see Dr. Day already smiling at that question. So I think there's obviously a lot of transition, and I think right now we're still working out that transition. A lot of that has to do with our patient population, the ones that's been seeing us for a long time, how that evolves, like Dr. Dan said earlier, as well as the overall structure. I think a lot of that requires pre-planning, to say the very least. So why don't we start in more of a chronological order here? I'll ask Dr. K to share, from 3.5 years ago when we decided what are the areas that need to change, and then we can ask Dr. Dang to share a little bit as to, the practice right now, how that's involved from a physician perspective as well. Dr. K, do you want to start us off?
Sure. I just want to raise a very important work we have done. Number one, the board need to compose of majority of health centers patients. So that's mean at least 51% of your board member need to be patients, which before we apply, we are not have a board member like that. So we have to restructure our board, inviting more patient to be board member, or we can ask our brother and sister to be our patient until at least the board need to practice more than 6 months, and with a record of every month we have board meeting. So a lot of preparation before we put the application. Thank you.
Thank you, Dr. K. Exactly, a lot of work, as you can imagine, making sure we have that representation on the board in order to even just qualify, to say the very least. Dr. Dan, what about from a provider's perspective, from a physician's perspective?
So how do we move or change from a free clinic to a community clinic? The first thought came into my mind was actually start charging. And then, but I'd say, in a way, we have already gone through that. At the very beginning, our Alhambra clinic has been a free clinic for many years. And if we look at the history and learn from it, what we have found out is that operating a free clinic, you are actually preventing to provide services for some patients. For example, earlier we were talking about commercial patients, right? So if somebody that has a commercial insurance and walk into our free clinic in the past, we probably will say, please go see your primary care doctor. That's what a free clinic would have operated. And go a step further, a Medi-Cal or a Medicaid patient that walking into our free clinic in the past, we would recommend that they go to their primary care doctor once again, instead of providing services. And all that would have been changed once we start changing ourselves or convert it into a community clinic. And I remember this is one of the major reasons why we started operating as a community clinic, especially at the beginning of Obamacare. A lot of patients, due to Obamacare Act, they were able to obtain health insurance. Unfortunately, the type of insurance they have, once they have it, they are having trouble finding a good primary care doctor. So they continue to come back to us. So to run a community clinic in a way, one of the definition I would guess that we can say is that we are starting or able to see patients with insurance, and pretty much we're working toward the goal that anybody that needs our services can come and get the services with us. That's kind of the idea. So it's to some degree it is just a title, a free clinic versus community clinic, even though there are more specific operations tied to it. But generally speaking, FQHC or a health center has to be evolved from a community clinic. And as I mentioned earlier, HRSA does not wish us to see patients for free. That is actually one of the rules that they have set. So if you look at our sliding scale, even with the lowest income, 100% or less of the poverty level, federal poverty level, it is not zero. It doesn't mean if they don't make or they make very little and we would see them for free. HRSA does not wish us to do that. So we end up putting a charge of $20. And we kind of look at our nearby local FQHCs and we come up with this number, which is pretty low. But then in reality, when patients had come in and they don't have that $20, and we will see them for free. So we are not going to stop providing services just because they are not able to pay the $20 minimum fee. On the other hand, if we were to operate as a free clinic, yes, we will see somebody that don't have insurance, but we will probably turn away more people that do have insurance. And we know for the fact that they are not able to find a good PCP. So I think that's another way of looking at the differences between free clinic and community clinic.
Okay. Thank you, Dr. Nai. Thank you, Dr. K. And I think, aside from that alone as well, in terms of the evolution, if you would, it's the shifting population. And I think in the past, from our Tzu Chi community clinic experience, we accumulated a lot of adult population. And one of the things that HRSA actually wants us to do is see everybody from birth. It's sort of from cradle to grave, right? So you see the whole life cycle. So it's not limited to just adults or kids. It's the whole spectrum. That's what they want to deliver, or us to deliver care. And I know there was one question in terms of pediatric populations. Absolutely. We have physicians, PAs on staff that will see kids as well. That's an area that we're going to develop with a major focus. So absolutely, we will see patient populations that are not just adults. So Brother Shea, I think you have another question as well.
No. I think this is a good information for me to make decision for what is the next step in our medical mission here. Thank you.
Perfect. Thank you. And one thing to just add to that is, obviously to utilizing our designation. What would happen is that the different areas would be, or the new clinics would be counted as satellite clinics to where we are. And there's some specific nuances to that, which really is in the governance structure, how we're able to extend the quality assurance, compliance programs to the new clinics. So those will be important areas to look into as you plan out. So hopefully that helps you. one of the questions that we have as from our audience, I think this is a good question, especially, we're talking about a lot of, we're in the Tima forum. So obviously we have a lot of great physicians that are volunteer professionals. And the question here is, in terms of accepting private insurance, I know we spend a lot of time talking about reimbursements and insurances. How does that conflict with our volunteer professionals? They're volunteering with us. We're billing insurance. How does that influence anything, if anything at all? And is that really a conflict? Is that something that really affects what we do? And I know we have volunteer professionals. We love their help here. Without them, I don't think we would have gotten this far. But it really comes down to target population too, right? I think Dr. Dan earlier mentioned that our target population is not specific those that are private insurance, but certainly we don't refuse them. But I think the specific question that I have received here is how do we strike a balance between all the volunteers that we have that still wants to come in and see patients and help Tzu Chi as a whole versus the practice that we're now billing even private insurance and amongst other insurance. So, Dr. Deng, I know you gave us a bit of a breakdown on the insurance already, and you came to us as a volunteer to start with too. How do you think that would affect the overall, and especially from your perspective?
Our Tzu Chi medical mission, which will include Tima and the free clinic or community clinic that we are operating now, is to invite as many providers that are willing to be part of us as possible. However, being an FQAC, we do have another set of regulations from the federal level to comply. So it will make a volunteer doctor to work at a clinic with a little bit, some degrees of challenges or difficulties because there are a set of qualifications that are being set. Well, I shouldn't use the word qualification. They would have to make sure that all the providers fits. And so they have to go over. There's a lot of missing the word here. I guess it's getting late. But the idea is it will make a volunteering doctor more difficult to work at a clinic just because it's quite tedious. And I remember back in the times when we were trying to recruit providers just to work with Tima. So we have this Tima application form. And it has been the longest issue for us to discuss that, shall we ask a provider to fill out I believe a 9-page application form versus a simplified 1-page or 3 pages, and even that some providers will say no. Now, and that is just a small example of having a provider who are willing to volunteer with Tzu Chi, and if you ask them to fill out 9 pages of application form, that may turn some people away. Now imagine try to work at a clinic. It's not just the 9 pages, it's more like 9 books. We have to really dig into the provider's background and make sure that what HRSA is asking are all answered. And some of these cannot be done by us. It has to be done by a third party. So, so that would prevent some obstacles having providers. Now, assuming a volunteering provider is very, very interested in working in our clinic and is willing to go through the whole process, by all means, that provider is more than welcome. A volunteer versus a paid staff, the only difference is paid, right? We have a lot of Tzu Chi volunteers that work in Tzu Chi and they do not get paid. Most of our volunteers are like that. So, they are staff, but they are just the unpaid staff. And I think there's a terminology for that too. I just forgot what it is, but it's the same idea. So having an FQAC does not say no to volunteer providers, but it does make it a little bit more difficult for a volunteer. They really, really have to wish to be part of us to join. It doesn't mean that they have to be paid in order to work in our clinic.
Thank you, Dr. Dan. I think that's absolutely true in the sense that we need to keep to a standard of healthcare practice, and being available to see patients on a consistent basis is important. That's why sometimes HRSA even mandates certain positions to be paid staff as well. So I think those are areas that really are reflected in that. And when we talk about the quality measures, I mentioned earlier in terms of the population that we serve, what kind of problems or chronic illnesses plague the areas that we're in. The quality, we call it CQI, which is continuous quality improvement, is a very important cornerstone of the health centers. And we're essentially measured on them by HRSA on an annual basis. So month to month, we have specific metrics that we focus on to ensure that the clinic is doing what it needs to do. Because it's such an important program, our Dr. Dang himself is involved, and obviously Dr. Lam being our chief medical officer. And, I think it would be a good idea to give everybody just a couple minutes to understand a little bit as to what that quality CQI really entails. Dr. Lam, would you be able to, I know you oversee that program, you have meetings every month on that. Can you give us just a brief overview as to, the measures we're looking at, maybe a couple of examples as to why that's important, especially when it relates to the kind of healthcare that we're delivering here?
First off, I'd like to let Dr. Dang know, I think you were looking for privileging and credentialing. I'm not sure if that was what you were trying to...
Thank you. It's getting really late here now.
So yeah, I think with any volunteers coming in, they do need to be fully credentialed, and there's a process that we go through that is more tedious because we have to verify that your license obviously is still active, where you might have certifications where needed, and so that's what he's talking about. So in terms of the clinical quality improvement, so basically HRSA looks at how we perform, and we cannot be performing like a free or community clinic where we do as we wish and we do our best and then hope for the best, and that's it. We are it. We are the primary care physicians for these patients. We take care of all of their needs, and we make sure that the quality of care they receive from us is not only at par with what all other private clinics and local community clinics and centers are doing, but we go above that and hopefully beyond that. So if you come into our clinics and we provide you care, it's not going to be of a lower quality. If anything, it would be of a greater quality than you would be able to expect from a private practice. For example, if you are a female coming in, age 51, then you would expect that we would ask you about all your immunizations to make sure they are up to date, see if you've had your age-appropriate cancer screening, and in that case would include, colorectal cancer screening, breast cancer screening, cervical cancer screening. And we ask you, we figure out, if you might be depressed or not, if you're smoking, and counsel you on cessation. If you had any cardiovascular disease, we would address that to make sure you're on your statins. If you have any ischemic vascular disease, we make sure you have some type of antiplatelet agent on board. So we follow all the evidence-based medicine and guidelines that are set forth for us, so that it makes it where when you come into our medical center or our health centers, it's not optional that I provide you, top quality care and meet all these measures. It's required, and it's a requirement that we are judged on. And as Kevin mentioned, every month we go through all of the measures and we see how we are doing, and we choose a measure that we focus on, and we see how are we doing, how did we do before, how are we doing now, how do we reach our targets, and if we are already at our target, how do we stay there and how do we go beyond that. So I think when we focus on all of that, we are no longer thinking of ourselves as, you know, the free clinic or the outreach style physicians who just go out and, you know, we just try to do our best for you and hope for the best. We really own the care of all of our patients, insured, uninsured, uninsured, all the way to the best commercial insurance, basically. And specifically, our focus is, of course, the Medicaid population, who, if they go to a private practice, probably won't be able to receive that level of attention due to the traditionally very low reimbursements at other facilities that are not FQHCs.
Great, thank you, Dr. Lam. And I think one of the key here is that being a designated health center, especially the spectrum of services that we offer, it actually fosters teamwork because the departments actually have to work together to deliver that comprehensive care. So if there is a matter which is being seen by our Western medicine physicians, and there's a need to involve acupuncture, for example, to treat, let's say, pain, and also vision care as well. So the whole team needs to actually work together to make this really happen and deliver the best experience for our patients. So it's a lot more than just individuals being able to perform at their best, but it's a whole team effort to deliver that whole healthcare experience to our patients. So it'll be important to have the right physicians, and it'll be important to build up the services that you currently offer or are looking to offer in the clinics. So I see Brother Cheaton has his hand up for some time now. Would you like to ask us a question?
Yeah, thank you, Kevin. I do have a few questions or maybe a comment. I think first one is about the mobile clinic, or I would say the extension of FQHC as a mobile clinic. So a couple of weeks ago, a few of us went to San Jose downtown to visit a kind of shelter site that providing the meal to the low-income or homeless folks there. And then we also visit one of the Medivan on-site, which is coming from Gardner Health Center locally here. So what they are providing, just providing a on-site Medicare service to the homeless folks. You know, people has a wound or sometimes even have a prescription there. But they only serve like a few, you know, like 4 or 5 people a day in a few hours there. So it's very few turn rate. And then they do require people vaccination. If they don't vaccinate, then they will go. They will not let them allow enter the van, but they will serve them outside. So viewing our, I think Brother Kevin mentioned that a couple of weeks ago, we do have our mobile clinic as our FQHC extension. So when you look at that clinic, the mobile clinic, what is the focus? Is that the same focus as, or we need to have certain percentage of Medicare patients in that particular remote site that we are going to serve, or we don't see that. We purely look at the need or the necessity or the population or target population that was really needed. We just go ahead to serve, sort of like as a free service type of thinking. So that's the question. Yeah.
Thank you. I think the mobile program is very interesting. And from what we see, at least in Southern California, is that the mobile program is really an extension of our clinics. So we offer the same service that we offer in our clinics, but on mobile, on wheels. And that's, I think, one of the most attractive areas. I want to sort of give a bit of a perhaps clarification on the sense that, yes, even though there are certain target population that, with the designation we want to see, it doesn't preclude us from being able to waive certain fees if they can't afford it. And we have been, especially in areas that we know maybe they're undocumented, maybe there are areas that are migrant workers, for example. Those are all things that we can continue to do. And I think the mobile, what it helps us is to reach areas where our clinics can't, or they can't get to our clinics. I think that really fits into the Tzu Chi medical mission, right? And Master said, for those that can come out, we want to be able to walk in to see them. And that's what we are with the mobile clinics. And I'm certainly really happy to hear that you're providing care to those shelters, etc. And I think we are going to aim to continue to do all that work because it is very meaningful work. It doesn't, just because we're designated and the Southern California mobile are in scope, doesn't stop us from taking care of patients in those areas. In fact, I think there's a lot we can do for them, whether that is through mobile or not. So those are things that I think we will continue to do, and if not even expand more sometimes on those as well. Dr. K, I know you were smiling earlier on that as well. Do you have, would you like to add to that?
Yeah, actually, you pretty much cover almost everything. One thing I just want to raise is currently we are collaborating with Pacific Clinic. So we extend our vision service and later dental service, maybe medical service to those areas. The main target certainly is medical patient, but we are not excluding other patients, especially undocumented patient. Thank you.
Thank you, Dr. K. Yes, absolutely. We would encourage to, even more of those activities, in fact, because I think under the same umbrella, it would really help, reach those patients that are otherwise harder to reach and those that can't come. So, Brother Chichen, did that answer your question?
Yes, thank you. Thank you. Yeah.
Thank you. Thank you for your question. We have a number of questions here as well pertaining to how, medical foundation here being and having FQHC lookalike clinics in Southern California as well as on mobile will help other regions pioneer their way or accessible to having those health centers as well. I know we've had a number of meetings with different regions, but in general, how does that help in terms of our experience, in terms of how they can potentially start exploring these ways? I'm just going to throw this question out there for our panelists to answer, because it seems like there has been a lot of interest and people are actually wanting more information as to what would be the first step that they should take.
I will start.
Okay.
Answering some of these. It's a more of a general answer. It really depends on what the regions would like to focus upon. So if we were focusing upon a medical mission style that we are very familiar with, having our Tima team running it, then there is no need. But on the other hand, if we were trying to do what FQHC is working, then that's a different story. So we have already spent a lot of time looking at the details of what FQHC operation is like. So that pretty much will be the baseline of what the region is, to see if any region is interested in having such operation. So if you wish to do all the measures amount all the patients that walk in to a FQHC, then by all means, that would be a good reason to have a FQHC satellite run in a different region. So medical foundation, we are acting like a seed. We already have a seed planted in Southern Cal. So all the other regions who wish to have a another or new FQAC, they will work as a satellite because it will be a lot easier to obtain, having a seat already. Certainly, we can discuss and see how that goes. So the way I like to answer these type of questions would be, we are changing, and we are changing only because we do not want to change. I don't remember the exact year, but we actually had a Tima convention, and that was exactly the title, to change or not to change. In the early 20, I think it's like 13 or 14, something like that. But in any event, we are changing, but that's because we do not want to change. Our Tzu Chi medical mission are still there. So a related example or question earlier was regarding the mobile. So the mobile can still see a very selected target, say the homeless group. And that indeed, it is Tzu Chi's mission. And the mobile was created to be able to serve them because they are a group of patients that cannot come to our clinic. But on the other hand, if you will try to look at it from an FQAC, that may not be the number one targets because in a way, FQAC is a health center. So it is fixed. It does not go to the patients. And if we were trying to operate it under FQAC, then all the measures that are part of the FQAC, that is something that we need to apply to all these homeless patients. Then the next question is, are we able to do all these cancer screenings on them, for example? And the answer could have been no. It's not easy because they are homeless group. So what does that mean? That means we are keeping our Tzu Chi mission, namely a mobile can go out there and serve this population, but that may not necessarily be part of the FQAC operation. And I think that is something that we can look at. So I like to summarize it in terms of our operation would be one major part, FQAC, but on the other side, we just call it Tzu Chi mission or medical mission. And that way, it will keep things much clearer. And that will, each different targets can fall under these two major categories.
Okay, thank you. Thank you, Dr. Deng. In terms, you treaded and onto a point which I think we're going to get to in a second here, which is sort of the expansion across U.S., not only in the U.S., but certainly across California as well, representing opportunities. We talked a bit about sort of the insurance breakdown, and what we can say from our previous experience is that as a community clinic, as a free clinic before that, we had a number of differences. I think Dr. Deng made a really good point earlier in that, we're not trying to discourage people from coming to see us. What we're doing is that we're increasing the amount of population we're seeing in the target areas that health centers are meant to see. So the ratios change because of that increase, as opposed to us actively trying to discourage people in general to see. There are some population that really shouldn't be seeing us because, we're not confident we can either deliver the best care to them, or that they really should be going to the areas where they should be, they could be looked after better. So those would be populations that we would, I wouldn't say turn away, but certainly encourage them to go back and see their PCPs. Especially if we're not. So those are things that we actively take, and that goes into a topic of, how do we maintain compliance? And compliance really comes in a lot of different ways. I know there are questions about that in our chat here. It takes form in not only in terms of operations, in terms of quality assurance, like Dr. Lam alluded to earlier, but it included a lot of different areas, different areas, such as how we process, how we, even look at bidding for different capital spends, how we manage expenses, sign-offs, all of those are part of compliance as opposed to just clinical ops. And so, it's still a learning process for us, but we're glad to, have a good team to be willing to learn and have good consultants as well to guide us through. Earlier on, you also met John, who comes to us with more than 20 years of experience. Those are all different pieces of the puzzle that helps. And for those of you that will be looking at exploring health centers in your respective regions, this will be an important resource to consider, which is how would these individuals help you locally in terms of guiding you through compliance, making sure that the operations fit your local audience and the market there as well. So those are things to just keep in mind. And one of the questions here pertains to interns and shadowing. I think I would like to ask Dr. Lam to give us a bit of a color on that, because right now we do have students that shadow with us. Dr. Lam oversees our providers who have shadowing students. And Dr. Lam, would you be able to give us a little bit on that? I think obviously we have been doing that. Can we continue? What's your perspective, especially when you were evaluating to taking them on for the different physicians we have?
Actually would like to go, I'll answer that question, but I actually want to go back a little bit in terms of people's questions regarding whether they want to become an FQHC like under our umbrella or not. I think a way to think about that is, I think the way that we've been practicing outreach in our free clinics is we provide what care we can. But I think as a health center, we have to become the clinic that we want to be a part of. So if we think about providing care to the homeless and you're thinking that's not really me, like this is just, I want to give them, do what I can outside or in whatever case, then I think the old way that we're practicing is okay because you just do your best. But I think as a health center, what I hope to see at least at Medical Foundation is we built the kind of clinic that we all want to be patients at. And we feel like we provide such great care that I want my kids to come here. I want my parents to come here. I want to be a patient here. I'm willing to be a patient here. And I think if that's the focus, I know insurance matters, but it also doesn't, because, as the CMO, it does matter because we're looking at those numbers. But as a physician, it doesn't. I just provide the best care. And I work, at UCLA, I work with LA County, I work now at Tzu. The level of care should be similar. And that's what we're aiming for, that you can see me at a UCLA health center and it's the same quality and it's the same person and it's the same care that I provide as you would at, Tzu Medical Foundation versus in LA County, even in the mobiles that go out. So when we go out with Pacific clinics, we're not providing inferior care. We are aiming to provide the high level quality of care. And we can even do, let's say, pap smears in our mobile clinics. Like that's what we're going for. We're a full blown clinic and we're the clinic that we want to be patients at too, because we have that level of standard and quality. I think if other locations are looking at that or looking to become that, then this route would make sense. So that just adds a little bit, like a sort of a different perspective to what Dr. Deng has mentioned. But back to your question. So interns and shadowing, yes, we can have interns or not interns specifically, let's say like students who want to shadow at our clinics, perhaps interns or residents who might want to rotate through our clinics. That is okay, but it needs to be arranged carefully. And that goes back to our volunteer physician statement as well. Anyone who comes into our clinics, who sees our patients, who works alongside with us, they do need to be, if they're a professional, privileged and credentialed. If they are not a professional, they still need to be screened. We need to make sure that they are appropriately, let's say, vaccinated, that they have reasons why they're there, that they play their specific role. So I cannot have, let's say, a volunteer who has no US credentials, but they might be a physician elsewhere, come into the clinic and provide medical care for my patients. That would not be okay because they are not licensed and held to the same standards or regulations as we have here for our licensed professionals. So with every person who might come in, they would apply and we would review their applications carefully, get a good idea of what their expectations are coming into our clinic. We let them know what our expectations are and what they are allowed and not allowed to do under the rules and regulations. And then we make a decision, and then hopefully everyone has a good experience because our expectations are met.
Great. Thank you very much, Dr. Lam. I think there are obviously a lot of great questions. We can't get to all of them, unfortunately, but hopefully this session has been helpful and useful to you. I just want to invite our panelists to give us closing remarks. Dr. K, do you want to start us off? We're just going to wrap up this session here. Do you have any closing remarks for all of us?
Yeah, I know a lot of people really want to have health center in their side, even out of California. But anything starting from zero, we need 3 powers. One is human being, manpower, and number 2 is money. And also the third one is will. You are willing, the willpower is much bigger. So if you have a willpower, you are going to make it from zero. Thank you.
Thank you, Dr. K. Dr. Deng, do you have any closing remarks for us?
Sure. I would like to close it with the same thought of what I just said. We are changing only because we don't want to change. Just don't forget what Tzu Chi Medical Mission is about. So becoming an FQAC is just one of the quote-unquote tools that we have chosen to use so that we can continue on our Tzu Chi Medical Mission. It does indeed provide a lot of great benefits. But on the other hand, it will make our routine work a little bit more challenging because we are now not only wanting to perform Tzu Chi Medical Mission, but we also have Uncle Sam's rule to apply, right? So all the HRSA rules is something that we need to be in compliance. It will make it a little slightly difficult. But once again, we are changing just because we do not want to change. And just have that in mind. And we welcome any region who would like to be part of the FQAC. We can always discuss. Thank you.
Thank you, Dr. Wang. Thank you very much. Dr. Lam, do you have any closing remarks for us?
I will add on to what Dr. Deng said. So we are changing, but I think it's good despite the regulations and some of the stress that goes along with it. We will be held to very high stringent standards, allowing us to still do what we love, which is care for all people, but with money, as Dr. K mentioned, financial resources, and then holding us to the highest standards possible so that we can provide the best care, that we can. So thank you.
Great, thank you very much. I want to thank all of you for joining us today, and also a special thanks to go out to our special guests, Dr. Liao, Brother Shay, Brother Mingjing, for being a special guest and joining us. We certainly look forward to expanding the footprint and really taking Tzu Chi Medical Mission to the next level and across the entire US. So thank you again for joining us this morning. We hope that you find this panel very useful. If there are any questions after the fact, please feel free to forward it to our moderators, session team leaders. We try our best to work to get back to you on that. We have regional meetings with many of you as well. So if you have additional questions, we'll be more than happy to schedule a meeting specifically with a region also. So thank you very much. And please enjoy the rest of the sessions for this Tima meeting. Thank you.
Thank you.
Thank you, everyone. Thank you. Thank you, everyone.
Thank you.
Bye-bye.
Bye-bye.
So thank you for joining us at our previous roundtable. We have a short break right now until 10 a.m. Until our next group of speakers prepare themselves. So please join us back here in about 5 minutes time at 10 a.m. Thank you very much, and we look forward to seeing you later. Thank you.
衷心地表明，我的生涯是服务人类。我尊敬和感谢所有人以谦卑、奉献和教诲。我将尊严而立心，以病人的健康为一切的优先。我将尽力而为，维护传统的荣誉和尊贵。何处需要抚慰，我们竭力爱，翻山越岭。何处需要关怀，我们漂洋过海，不让爱枯竭。追随上人的慈悲，让苦难人间化作流离的世界。我将付出一切，发扬慈济医疗事业的光辉。守护生命，守护爱，守着人间的慈悲，让自己的医疗成为日不落的世界。因为奉献了一切，因为无怨也无愧，让卑微大一方都是照亮大爱。
Hello, everyone. Welcome back to our session of Tima here. We're going to continue on to our breakout sessions. I think a lot of you will be very much looking forward to this since this morning. You will see here there are 4 different breakout rooms, and we need you to help us coordinate that. And how you're going to do it is by renaming yourself. On Zoom so that we can put you in the proper breakout room. It may take us a few minutes though, because we have over 200 participants. So how you are going to rename is by putting in before your team number, the breakout session number. Okay, so we're gonna talk about, oops, sorry, give me a second here. So we have 3 different ones here. Okay, so before we go into that, I'm going to go through it in chronological order. So if you want to join the medical session, that's number 1. You're going to put 1 and then T or whichever designation you have. So let's say you're team number 5, you go 1, T5, and then your name. If you're team 3, you go 1, T3, and then your name. So just make sure that you're able to do that so that we can put you in the proper sessions. If you want to go into number 2, which is our dental session, you go 2B, your team number, and then your name, so that we can put you in the proper session as well. That's So once you're done with the session, your session group leader would let you know, and you'll be put back here into the main lobby. So if you have any questions in the interim in your breakout room, please make sure you let your breakout session leader know. We'll be able to assist you along the way. So I see that we still have about 100 participants or so to assign. Just be patient. We'll be able to get through that in the next few minutes here. If you haven't named yourself, please do so right now. Otherwise, we wouldn't know which room to put you into. I see that there's still a handful that haven't named yourself yet. To rename yourself, you're going to have to find your icon, the box which you're in. If you put your mouse over that, on the top right-hand corner, you're going to see 3 dots. Okay, you're going to click on the 3 dots and click on, there'll be drop down and click on rename. And that's where you would type it in. Once again, you have to locate yourself first in Zoom. Okay, once you have located yourself, usually it's the first box. You will put your mouse over that box. A menu will show up. You will say mute and 3 dots. You're going to click on the 3 dots and then click and select rename.
So basically, for this talk, and I want to
sorry, we can't hear you. You're cut off. Okay, so we're gonna make our way through. It should only take another few minutes, so please be patient with us as we assign all of you to the rooms that you've elected to be part of. And for those of you who have not named yet, please do so as soon as possible. I see there's still a number of you that has not named yourself yet. Again, make sure you click on the box or put your mouse over the box there you're in, click on the 3 dots and select rename. And just to remind you, number 1 is medical, number 2 is dental, number 3 is acupuncture, number 4 is our volunteer session.
有8个。
Good. So who's going to be first of the 7?
雪满师姐。
I think I'm gonna start now.
Yes, please.
Okay. All right. I'm gonna share screen right now. Okay. Let me. Can everybody hear the voice? And
Yes.
see my slide PPT?
Yes.
Okay, that's good. 敬爱的上人、金色师父、师兄师姐们，大家早上好。I would like to find it out. Which language do you like to prefer for the presentation today? Whoever don't speak Chinese, I don't mind to speak in English. But can you chat it? Let me know if you definitely need English speaking.
But我们有60个 participant， 所以我想你应该有些人不会中文。
I think mainly when we started, that time was instructed that this Tima convention will be in English conduct because we have non-Chinese speaking in this forum too.
Okay, that's in English, no problem. Okay. Anyway, good morning, everyone. Dear Master Chen Yan, Jingsi Board, masters, brothers and sisters. Good morning, good afternoon, and good evening. This is Dr. Shirley Chen, Director of Medical Development Department. I'm reporting to behalf of Tzu Chi USA headquarters about local volunteers work activities. In the past year, we had held some activities to serve communities and the Tzu Chi families. For today, my report has 5 main sections. First one is medicine refills. Second one is called COVID-19 vaccinations. Third, loving care for Tzu Chi families. The fourth, Alzheimer's Association training, and the fifth were medical kits for headache relief. It has been more than 1 year since COVID-19 first started. Until now, we're still unable to resume our community's outreach. However, many of our patients have chronic disease and need constantly the medicine. So we show our care and support by mailing their medicine and other items to maintain their health. In these pictures, you can see some of the items. We send to them every quarter. Here you can see the numbers of package and send it for every cycle, start from September 2020 until now. So far, right now, we see what's the volunteers involved, and that's how you come into the section about. We recorded by bilingual volunteers to call patients to assess their need for refill and understand their current conditions and promote vegetarianism. And also our volunteers pack the medicine and mail the package out to the patients. We're thankful for those volunteers who can help us to call and to do all this dedicated work. COVID-19 during the pandemic, we also held a vaccination event in our headquarters, St. Tima's and Las Vegas region. Las Vegas chapter gonna report it by trading, but it's still under the headquarters. So we are ongoing. The COVID-19 pandemic claimed millions of lives. By the end of 2020, the federal approved the vaccines. Due to the limited number of vaccines, many could not get the vaccine. With the help of the medical foundations, Tzu Chi headquarters managed to get vaccines that we can provide through our medicine. And now you can see the number of the vaccine we gave it out, the May the 1st and May the 29th. Las Vegas, I think as trading gonna report it later. Okay, that's the number. Okay, and what's the volunteers' involvement? Definitely, there's a traffic control. Lots of people's coming through. We have to make sure they are all in safety issues, distance, parking, and how the patient get in and the flow. Registration, definitely flow in and flow out. Nursing stations, they do have some comfort area and also to help it out the nurse or a provider to do some work. And then introduced what the Tzu Chi about. Bamboo Bank, Jingshi products. And the final, we have to promote it vegetarianism. So it needs a lot of the helper and the Tzu Chi volunteers to work it out if it's the professional event. As the photo, couple of slides, you can see there's a help needs and there's the promotion needs, and our sister brother has to show their compassion and love to care, listening what they do have the problems, and also to recruit them as our Tzu Chi member. And this is what the Las Vegas about. And for those couple events, we do include bone marrow drive. Well, one is Las Vegas and one is the headquarters. We all doing the same thing. We have the bone marrow drive registrations, and we do help the couple of members to get the number registers through the online register and swap. They could put them database into the nation level. So that's the way we care and cure those who needs it in the bone marrow drive. First medicine, first medical outreach since the pandemic. We have a consultations at the Tzu Chi headquarters. We held this event at campus St. Dimas. We do services, consultation only. For patients, it's all our brother and sister. At this time, we do no treatments, but we do have a Western medicine, Oriental medicine, dental services. People's our families. You can see a couple numbers from the Oriental medicine, Western medicine, and the nursing stations, general volunteers, how many they do involve. And we have a lot of questions, especially for those our families. They do have a worry about it, psychological issues, or their family issue need to have a charity care issue comes out through this event. Doing the comfort, care, and love, through our volunteerism, we bring out all those issues to the charity, to our family and the community. So encourage everyone for this event. It's not just only the medical services. We do provide the care for everyone in needs through every aspect. Couple pictures you could tell, that's medical, and that's the dental, that's the nursing stations, and also consultations. Alzheimer's Association. In December 2020, Tzu Chi USA formed a nation-level partnership with Alzheimer's Association to increase awareness of this disease, especially in Asian community through the educations. Train the core team of volunteers to conduct outreach and deliver the programs. Training was conducted in Mandarin. That's how our sister brothers, they can help it out to express the important message for those people and in need, how to do the preventions, especially through the medical outreach. We are not just only doing the treatment, we also bring out the message, knowledge for people who needs it, especially for Alzheimer's and dementia. Total registration for volunteers, 6+ volunteers has been signed up across the pilot program, headquarters, New York, New Jersey, and North California. They've been held this association with a couple good programs for years. They do very good example, and they held this event through the nation level. So our sister and brother can learn, no matter you are just started or no matter you already has experiences. That's how we can help this one through all the chapter in United States. And we are bonding the connections through the nation level with their association. Make our event special for the outreach more successful. Obesity, later on, everything gonna see the differences. So this is just the program we have this year. Hopefully we can conduct all necessary events and virtual lectures for next year too. This is how that event for topic through from the February through the April. And the other chapters, they have a virtual lectures already presented through the virtual, special for those in Mandarin speaking volunteer. They can learn how to become the educator and facilitator. And thank you all for those already signed up. We continue to support this program in 2020. Medical kits preparations. On August 14, 20 and 21, Haiti was hit by a magnitude earthquake. Tzu USA get a chance to prepare the medical kits to be sent to earthquake survivor. Originally, we just only want to have 5,000 of the kits, and the other 10,000 gonna go through Dominican Republic. By any safety issues, we take it over this is a work because they couldn't make sure the safety to deliver to the earthquake survivors. And each kit contains the face mask, alcohol prep pads, hand sanitizer, iodine swab, elastic bandage, gauze, band-aids, antibiotic ointments, scissors, gloves, and trash bag. For the first batch, we already had 60,586. It's been shipped out to the survivor already, and they already received. And the second batch, we're gonna become out 10,000. This coming Friday and Saturday, all our sister brothers gonna help it out to prepare for it. By donating this bag through one of the vendors is our sisters. They are very, very good looking bag and also very good quality bag. And definitely while we put on the logos on, it just bring out the same love and care, the same as we have first page. Everyone happy to work it out. You can see the prepared work. They can take it home, doing all the prepared work. And all the school and our elementary school, even the Tzu, they can call up for the family and the elder peoples from home. They also can do help. So that's gonna collaborate with all people's volunteers, members, and our recruitment members to do all this kind of work. At the local services center headquarters, then we put it all together. Right now, we are prepared to ship it out another 10,000 this weekend and to the Miami and go to the Haiti. I think as a hospital probably now not in needed very badly, but especially for the survivors, everyone at home, they could receive it with love and care from our sister and brothers. The secret of the Tzu Chi success is thousands of dedicated hands and the volunteers. With your help, with everybody, the warm heart, bring all this work together. And thank you all for give me the time and the opportunity to share. And thank you so much. I hope I'm cut out on time. And thank you.
Thank you, Dr. Shirley. Next, I'd like to invite Sister Trilling to report for the Las Vegas Service Center. Sister Trilling, please.
Okay, can everybody hear me?
Yes.
Yes. Okay, thank you. Yes. Thank you. Dear Master and board master and all the brothers and sisters online, good morning. Thank you, Medical Foundation, give me an opportunity to share. Since 2020, the COVID-19, we all around the world, Master say this is Hello? So,
I don't know what happened.
I don't know what happened. It's a break room.
That's right.
Are we still here?
Yes, we are still here. Please wait a little bit.
Oops. Everybody coming back. I will just wait for a few seconds for everybody to come back, join. Okay. Okay. As Dr. Shirley said, Las Vegas is under a headquarters, so we really appreciate headquarters support to help us all the activities during the pandemic 2020. So to us in Las Vegas, we did a lot of, we're not, just stay at home. We do a lot of volunteer work as well, pretty busy. So thanks to headquarters and Hualien Tuandui team who sent us a lot of PPE. So our volunteer, we distribute to our local hospital, a doctor's clinic, nursing home, Salvation Army, churches, and also we have a food distribution ×1. We collaborate with a local charity. And even though we are able to get a vaccine to serve our local elderly Asian population, because in February, when the vaccine started, and a lot of elderly who goes to the convention center online for 2 hours, and then by the time they say, oh, you did not make a reservation, so they cannot give it to you. So for that reason, our Dr. Fan and Dr. Edgewood, they call me, they say, how about if we can get vaccination in our Tzu Chi office to serve our elderly? So thanks our doctor, and our local volunteer, we have a great team. We work together and we serve 3 times vaccination in our Tzu Chi office. And we were able to give vaccination more than 500 people, like 553 people, Asian population. And also they are not familiar or they are on the front line volunteers, give them vaccination. And also the meantime, the government called our Dr. Fan, our doctor, to see if they can serve us more, which is the bus vaccination. I think this is the only one all around the United States, the only one bus vaccination that time. We put the news out so the people can call us, and we make a reservation. And every time the buses, they give us the 2 buses every time. So we can have, because of the social distance, we can get only 20 to 30 people in 1 bus. And then we did 7 times. So we served about 226 people. So this is a great work. And also we have opportunity to do bone marrow drive 3 times, 1 in Tzu Chi office, 1 in the doctor's office to do the bone marrow screen. So we have done all this great work with all the great volunteers in Tzu Chi. We cannot do it by ourselves. We need a team. We need a good team. And fortunately, we have a very good group of good heart doctors and families. We were able to do all this vaccination. And because of this activity, a lot of people who call us, they wanted to be volunteer, and also we recruit a lot of new doctors, because from one doctor to invite another doctor. So we have we recruit a lot of new doctors, a pediatrician, internal medicine, and of course dentist. So we kind of expand our crew. So that is a wonderful news. And also we have a lot of young people, young volunteers. They also join us. So this is an extra bonus while we're doing that. So this is also Master wish us to do, because we're all getting older. We're not getting younger. And we do need all this young generation to take over and continue the Tzu Chi spirit and the Buddha path. So, and also our doctor, Dr. Edgewood, she's a assistant professor in a medical school, Truro University. She also brought her students to help us for 3 times vaccination. And we did a tea ceremony, appreciation tea ceremony. It was really touching. The total 14 of the medical students, I don't think they're going to ever forget this experience. And I hope the Tzu Chi spirit will carry in their life along with their professional life. So this is one really, we really appreciate we have opportunity to do that. And otherwise, Master is telling us this is a big disaster. It's also a big education. So what we have to do while we are all learning how to survive with COVID, and most important is, number 1, we have to follow Master's teaching. We have to 行菩萨道, 抚慰众生. The second, we have to have all the good deed in your heart. We have to always 心存善念. You have to have a good deed in your heart. And then the one more thing is to increase our immunity. While all the scientists who invented the antibiotic, all that, the meantime, we have to increase our immunity, do exercise, good nutrition. And how to do the good nutrition is go veggie. So we have to promote the vegetarianism and ourselves, and to be a vegetarian. And then, hopefully we can spread to the community, to your neighbor, and all around the world. So in that case, hopefully one day the pandemic will be decreased and everybody will be healthy and safe. Thank you. This is from Las Vegas report. Thank you, everybody. 感谢您的聆听，感恩。Who is next?
Should be the Phoenix.
Phoenix.
I don't know who's the Phoenix. Liu, Sister Liu.
Liu Shixing.
Okay. This is Ren Jixing from Phoenix, Arizona. We are with Phoenix Service Centers. Okay. Somehow I cannot see. Are you going to pray for me about the PPT? Okay, let me go straight. Right now, somehow I cannot see the screen. Arizona have the largest Native American reservations. Its size about 3 times of the Taiwan, and the population is about 200,000. But the problem that we face is that more than 30 to 40% of the families inside the Navajo reservation is without running waters. And if we went back to the last year's situation, okay, not too many people are aware of, Navajo Nation has the highest infection rate of the whole nations. Okay, they are in the worst time period, they are as high as about 15%. and also in Phoenix metropolitan area. Okay. At the end of last year, our infection rate is about 12%. Okay. So let's go to the next page. So you can see the Navajo reservation is on the northeast side of the Phoenix. The round trip time is about is more than 10 hours. Okay. So go to next page. Last year, our office shut down because at the beginning, we really don't understand the pandemic situation. We shut down about 3.5 months. That's between April to August. Okay, during the period of time, that's the time that we distribute the PPE among the metropolitan area and also into the reservation. We went into the reservation 11 times, assist about 10 medical organizations, and we also work with 2 organizations locally because it's very hard with 200,000 people scattered around 3 times of the Taiwan size. You really need to rely on the people to lead you if you really want to meet the families, okay? So we rely them to distribute it. We only deliver to the local chapters, okay? They are community center. But as far as distribute into the family, we rely on them to distribute it. And in total, we distribute about 50,000 of the PPE. Okay, let's go to the next page. So, you know, with 200,000 people, okay, they have about more than 100 chapters, okay? And you cannot just rely on the GPS to get into the territory. Of course, go to the villages, there's a paved road, but once you go into the third road, there's no GPS map, okay? If you are driving on the third road and there's a split in front of you, you really need to make a decision whether you want to go right or go left. So, and there's one particular hospital that I would like to mention. That's a Sage Memorial Hospital. We send the PPE twice. In the worst situation, last year's, our car need to wait in front of a long line of the automobile. They are waiting for testing. Okay, and also the helicopter, when we are delivering the goods to the receiving departments, the helicopters in front of us, they are trying to send the emergency, the ICU unit patients. Because you need to know inside the reservation, they send 20 units of the ICU. The serious patients, they need to lift this through the helicopter back to Phoenix or Flagstaff or the Albuquerque's. Okay, so if I recall the last year's situations, when we are going into the most serious regions among the nations and try to assist them, it brings back a lot of memories. Okay, the next page, that's the purchasing department chief, James Jefferson. The picture shows that he opened up our delivery goods, and what they need the most is the coverall. That's a protective gown, coverall. That's they are the most short of at that period of time. If you go to the next page, you will see the purchasing department personnel, bottom left corner. She wear our protective gown, and he showed us a list. That's the most wanted list for their hospital. And we deliver the goods in time for their need. Okay. Next page. The Sage Memorial Hospital is the only hospital run by the tribe. Okay, and it was founded about 100 years ago. by the Catholic churches. Okay. And this is the, as you can see, all the pictures, we are not only deliver the PPE, we also deliver the instant rice, instant noodle from our Hualien headquarters. And along with that, we also give them our master's biography and also the magazine from our US headquarters. Their goal and their missions are very much in line with the Tzu Chi. You know, some 20, 30 years ago, they also have a nursing school to train the nurse, but now they do not have it. So this is the hospital we identify that we would like to continue to support them. Okay. And next one is that after we deliver all the goods to all the medical institute that we can find, okay, that's a long story about to gain the trust from the Navajo Nation. It's, at the beginning, it's a very difficult. Even we just want them to sign. It's just a very simple list. The goods that we deliver to them, you know, they say we need to send you a receipt to our legal counsel. So this is actually at the beginning, it's a very difficult mission, but we overcome with it. And after the deliver to the hospitals, we start to work with the local chapter. Okay, this is a Huaycong chapters, the villages. And in addition to the PPE, we also send them the affordable beds and the blankets made out of Tzu Chi's recycling bottles. Okay, what they need is that once, because their house is very small, so once there's a family member infected by the COVID, basically they pitch a tent at the backyard, far away from their house. Okay, and they don't have a photo bed, and their situation, they are very short of the supplies. So we supply all this, and especially the photo bed and the blankets. They are so excited and about the quality that Tzu Chi provides. Okay, next. Okay, they say their British chief told us that among all the goods they receive, they feel Tzu Chi's quality is really high. They feel the love and the care from the Tzu Chi Foundation. Okay. Okay, especially next page, we are very grateful to the strong support from the Tzu Chi big families, especially from the Hualien headquarters, the US headquarters, and medical foundations. We also receive strong support from North California, from the New York. I know some of you are online. I would like to express my gratitude to you. Okay, and also from Las Vegas. Okay, and on the left-hand side is the newspaper report, local newspaper. Okay. So what next page? What are we going to do in the future? Right now, the vaccination rate is above average. It's very good. Okay. But as the follow-on, what we are considering right now is how to integrate education and the medicine. We would like to use the example from the Africa. They have very successful example of family member from their charities missions, and then the student go to elementary school and high school in Africa, and then they have then come back to the Tzu Chi Technical University or or medical school to get the education. And some of them graduate already, and they can go back to serve their communities. We are thinking maybe set up a scholarship or some other kinds, or maybe US situation is slightly different, or maybe we can set up a dual degree with local universities. So some of them can go back to Tzu Chi University during the summer or during 1 year of their school and get a 2 degrees altogether. Okay. And also we are thinking about to support them like a State Memorial Hospital equipment. And also we would like to see the possibility have medical mobile unit to go into their reservation. Okay, I need to go faster now. So we also go to a metropolitan area, and you can see that the Tucson, Flagstaff, and the Phoenix, we distribute many PPE also. Okay, let's go to next page. And we open up our office start last August. Until now, we have not stopped. Okay, we distribute the food. As you can see, the sister, we wear dual mask, face shield, and we continue distribute the food to the people in need. And as you can see, our gratitude family, they also give back the piggy bank. And we also receive many food from the local contributors. Okay, let's go to next pages. And the most serious is also the homeless people. You know, we stopped until last December, but last December, the infection rate at Phoenix is about 1 out of 8. In other words, 1 out of 8 people test positive. And in the park for the homeless people, they are really hunger for food. And so we start our program again, but that's the most dangerous area because they don't wear mask, they don't get vaccinated. So, but we set up the SOP to counter that. So far in our missions, Phoenix office had no volunteer got test positive due to the charity missions. Okay, last page. Okay, this is my last page. We are really appreciate the strong support from the U.S. headquarters, from the Hualien headquarters, and also all the brothers and sisters around the U.S. Okay, we will continue our efforts in Phoenix, and we would like to invite you when we have time to set up our mobile units or go into the reservation. We like to invite you to come to join us for the missions. Okay, thank you very much, and thank you for your hearing.
Hello, everyone. My name is Samantha. I'm medical volunteer from the Northern California. I'd like to introduce what is our program in the Northern California, the medical mission. We have the medical program. Next page, please. We have the myopathy, the fixed location, the dental and the Eastern medicine. That's called traditional Oriental medicine. And also we have the future, the chiropractic. And during the pandemic, we've been closed since last year until now. And we started have love and care for our volunteer for the Chinese medicine and the chiropractic. And for the dental, maybe started on the next month, October. And on the November, we are open for the public. And that's the fixed location, the medical program. Also, we have the medical outreach program and the local community outreach. Medical outreach program, we go to the different area, and the local example, just like San Jose, Fremont, and Cupertino, and some the low-income elementary school. Also, we provided a health seminar every 3 to 4 months, depend on the doctor's availability. Speaker. Next page, please. Also, we do the dialysis support group and the bone marrow organ donation and medical volunteer orientation and dental assistant training. Dialysis support group is very important for us. that can be dialysis support group is the 2005 already. Okay, next page, please. And this is our, I think it's missing some page. We do the previous page, please. Previous. Dialysis, we do a dialysis training health seminar and also have the dental assistant training and medical volunteer orientation. Okay, next page. Sorry about that. And this is our acupuncture, the fixed location, the examination room and the treatment room. And the volunteer, they can help the acupuncturist. They can change it, the wipe down all the table and the change the disposal of the paper after between each patient. That's the volunteer that can help. And the next, that's chiropractics. Oh, missing the photo. That's okay. Yeah, we also have the chiropractics, the examination room for our volunteers start on the July until September, and the same thing, the picture is missing, so I'm so sorry. And so the volunteer, the same thing, helping the chiropractor and the wipe down between each patient, and put the disposal paper on the face area because you need the face down. Okay, next page, please. This is the last outreach on before the pandemic. That's the 2020 January, and this is on the Conquer. And this is only we do the acupuncture and the dental is very, and they don't have the bathroom. We use a portable bathroom and the washing area. Next page. And this is in the Chico, the Magalia. That's in the church. That's the outreach. You can see the volunteer. They can introduce the Tzu Chi bamboo bank, what is the Tzu Chi about, and the professionals, the volunteers helping to fill up the paper for the registration, and then go to the triage nurse that will do the intake and do the screening. And then go to the service. And this is our volunteers talking to the patient. And we have to interact with them. That's all the volunteer they can do. Actually, the non-professional volunteer, they can do a lot of things. Next page, please. The non-professional, everybody thinks that I'm not a professional, and so I cannot help. Actually, non-professional, we need a non-professional to support. The example, they can preparation before and after each event or the clinic. Also, they can do the registration, do the EHR system. We learn from the Fresno, the brother Stephen. Also, we need the volunteer for each department: dental, acupuncture, chiropractor, vision, internal medicine, and bone marrow and organ donation area. And also we can deliver something for the relay to the medical event. And dental assistant, that's dental department will train the dental assistant. When they feel comfortable, they can start helping the outreach or in the mobile clinic. And also they can help for the 3-in-1. That's really we need it for 3-in-1. That will be what's a 3-in-1, the photo, video, and the interview. You saw some patient or the volunteer, very special. You can interview them and have to write down the documentation and post it.
Sister, we may need to hurry up. We have only 6 minutes for 4 more.
I know that before they got spent too much time. So I'm so sorry. I try to get it. And the dialysis support group. Okay. And next one. And translator, very important. We need a translator, especially Spanish. In our program, we had a lot of Spanish people, even in the clinic, in the fixed location area. And then public relations, this job is very generate positive publicity for the Tzu Chi. They can connect the outside or organization, the possibility and the mainstream the society, and that's very important job. We need the public relationship, the volunteer. Okay, next page. Next page, please. Oh, okay. This is, and after the pandemic, we deliver the PPE to the community hospital when they need it. And when it started, first time we delivered to the Kaiser in the Santa Clara County, that's called the Valley Medical Center. That's the first time we deliver. We use our supply and whatever we can, how much we can have it, we deliver. And gradually we support gather from the headquarters medical foundation, and we deliver to all the different hospital, private hospital, a community hospital, and also in the fire station and church and the school. And when residents, the low income, they need it, whatever they need, we deliver all by our volunteer. And we had we did the COVID-19 test in the last year and collaborate with the Santa Clara County. And that's a very good point that we can have the starter relationship with them. And then this year, we just on July 24, we have the vaccination site. And that day we only received the 21 clients coming. But actually, because it's been going on for so long, but there's still a lot of people have now vaccinated. That's why we provided the site for the Santa Clara County. And so we got the 21 clients, and also the Tzu Chi provided the gift, ginseng tea, and try to make a good relationship with them. And also very happy we have the collaborate with the Santa Clara County. That's the good, that's a mainstream society. We love to do that. Thank you for listening. A healthy mental attitude is vital to good health, when in turn lead to a happy and fulfilling life. I'd like to share this is our ginseng aphorism. Thank you.
Thank you, Sister Samantha. As you may know, we are falling behind the schedule about around 20 minutes. So for the following presenters, please help condense your presentation. And we are trying to wrap up real quick. So thank you for understanding. Next, let's move on to the East Coast. Please welcome Brother Tran Fong from the Mid-Atlantic region to share his report. Brother Tran Fong, please.
Hi, Master Jinsi, Abdul, and the worldwide Tzu Chi volunteer, everybody. I'm happy to have this opportunity to introduce the New Jersey chapter's medical activity for during the pandemic period time. Well, I think I can share my screen a bit quicker. All right. So during the this period time, we because the main focus is on the pandemic, prevention, or not a prevention, but basically prevention, and we don't provide treatment. So that's why we facilitated a lot of online forum and then the seminar, and then focus on the COVID And because we have lots of volunteer or community member that have some kind of anxiety and then how to deal with the COVID. So that's what we coordinated with the doctors and provided all this seminar to explain and provide information. So through that the process, you can see that we kind of talk about what type of should we take an antigen or antibody, and this is done by Dr. Karen Ling, right? And then we have one volunteer who's a pharmacist at Penn State Hershey Medical Center, and then he provides some knowledge about the difference between the cold, the flu, and the COVID-19. And so, Brotherhood and have a detailed explanation to let everybody knows the difference between the cold and the flu. And then they talk about what the flu virus and the bacteria and what are the difference and how they work. And also talk about the flu prevention and the treatment and type of flu vaccine. And then we change the subject, to be more focused on the COVID-19 virus and then what type of symptom and then the development of the vaccine. And afterward, we still waiting for the vaccine, right? So Dr. Han graciously provide more knowledge about the COVID-19 vaccine, because by that time there's more development, and then we also know that what vaccine are available. I think around that time, pretty much just Moderna and Pfizer. So that's we talk about what's the difference, and then what are the expectations. And was again because the COVID vaccine situation keep on changing, and then based on the new data, the government changing the way to deal with it, and same for the local government. So we Dr. Lin also provide from her perspective, because she's a frontline and working in the hospital, and she had more information. So that's why she provides us some update, right? And then this in August, so that we definitely have more, because by that time, more people have been vaccinated, right? And the more have a 2 doses of vaccination. So now kind of subjects start changing to whether people need to have a 3rd dose. And then that's the current topic, the White House is trying to push forward. So that's why Dr. Han provide us about what whether who will need the 3rd dose, right? And then I know Sister Sherry also mentioned that we have a cooperation with Alzheimer's Association, so that we have volunteers went through the training to be the educator and the facilitator, and then so now we start organizing the seminar, and then this is the first one in August 29th. The first topic about 10 warning signs of Alzheimer's disease, and then it drew a lot of attention, and then the participant had lots of questions. I think that's good. It's a successful event, and then also. Then we start going to organize the next one. So this is the next topic, which is understanding Alzheimer's and dementia. And same thing, and it's not just to the volunteers, also to the general public, and then also especially for the family who might have elder living in the household, and then that's really give us a lot of information to see what we're going to deal with it, right? But through the time that really we mainly work on the online seminar, right? Really we haven't much chance to go outside, except that we distributed the PPE we received from headquarters in Taiwan, right? So we start working going out. We will have the first flu vaccine drive in October, mid-October, and then that's we partner with Durham, which is a Walgreens pharmacy, right? And so we hope that we can really expand our activity more to outreach to the community. But I would definitely have lots to learn from all the other chapters, since that you have lots of activity and so inspiring. So I'm glad to have this opportunity to learn more from you, and then also have this opportunity to share our activity. Yeah, thanks.
Thank you, Brother Chuanfeng. Next, please have Sister Shufang from Boston give us a brief sharing for the Boston Service Center. Sister Shufang, please.
OK， 大家好，亲爱的上人跟亲热师父，大家好哈。This is Xu Fang from Tzu Chi Boston Service Center. My sharing today will be pretty quick. I have quite an overlap with Dr. Yang, who is presenting last. So for this year, 2021, our sort of the broader topic or project is on healthy community, which is sort of the extension from last year's Tima, that one of the U.S. Medical Foundation's major topic is healthy community. So for the first one is more for the activities. We follow New York region's project, which is for the exercise and vegetarian project. And this project involves the every Monday we have an online exercise sessions, and we also have one sessions in the summers for the study her function in our local service center. And for this project, we also work with community organizations to organize events like the go to a park and promote we provide the vegetarian lunch, and we also provide our 环保块 as a prize for some games. And this one we work with a community like 侨教中心、台商会 and like 台湾龙舟队 trying to promote the vegetarian exercise and environmental. And the second section is for the healthy community, is for the seminar. We utilize the seminar provided by the medical foundations and New York regions and our local. We also did for the Tzu Chi academies during the school year. We will ask one of our medical professional to write a very short paragraph about their health. For example, during the kidney month, we asked the nurse and the doctor to write a very tough paragraph about the signs. How do you know, or what kind of tests or indicators that you need to know to sort of evaluate your kidney's health. And all the free clinic, the Ethan is postponed due to the COVID. And we also do the community outreach, including the Alzheimer's project. And this year's PPE distribution is focused on the homeless shelters or the organizations like church that serves the homeless individual or families. So we distribute those masks to them. And this is the first, we also do a bone marrow registration this year. So I'll be really quick. So those are the events that I just mentioned. And so this is the seminar. You can see, as I mentioned, we utilize what is provided by the medical foundations and work with the New York region And for the COVID one, we also work with local community like 侨教中心 and 台商会, trying to broaden the audience to promote the vaccinations. And the third one is Alzheimer's. We have one师兄finished the training, and right now he is the certified instructor, and we can start to go into the communities. And as mentioned by previous presenter, this is a cooperation and between Tzu Chi and Alzheimer's. So right now we're trying to distribute those materials with both organizations' logo. And this is what I share with our medical volunteer here is a medical team is involved every individuals, and the goal is the combination of each individuals to work seamlessly together to achieve the goals that or the visions that Sunland give us to the medical missions. And how to do it is to basically do what you are supposed to do. And I think that is a kind of the attitude I like to share with all the volunteers in Boston City Center. And CISA is trying to make the cooperation and together within your communities. And I think that's only when everybody work together and we can achieve the most. And so this is my sharing today. Thank you.
Thank you, Sister Shu Fang. Next, we will have Dr. Richard Yang from the Northeast region who would like to share what their region has accomplished.
Can I be the co-host too? I'd like to share my slides. Hello? Can you hear me?
Okay, just a second, Dr. Richard.
Huh? Okay, just save some time, and now we're working on the PowerPoint. 亲爱的商人、基社师傅、各位军长、师兄师姐，大家好。Good morning and good afternoon, everyone. This is Dr. Richard Yan from Northeast Region Chapter. Medical missions, we have divided by 3 stages. Last year, we tried to educate and prevent COVID-19. And then we start a second stage to try to rescue and do the caring on the missions. Okay, so you can see the slides with 2020 and 2021. We have a different objective. Then 2021, we have a second wave of PPE distribution. Then we have a healthy community projects going away to the right now. And we have a flu shot. We do have a blood drive, and we connect with Hispanic community and other vulnerable community for PPE, vision care, and food pantries. We're going to. Okay, then we continue with region and sister vaccination against the COVID-19 virus. organize and train a volunteer to vaccination assistant. Then we have a third wave of PPE distribution, and also resume the vision operation and resume the free clinic and outreach. The next will be, we try to get the next slide. Okay, so the TAIPA and they seeking the partnership with our association, and we're doing the Flushing and the Chinatown, 2 area. Next slide. Those are the volunteer and the TAIPA CEO. We finish the mission and we take pictures. And next slide. We start to have our Vision Mobile missions with Ecuadorian community, and we couple with the Judge Common, and we have 44 people at the Vision extent, 41 pair of eyeglasses, and 78 volunteers come for 2 events. And also back to school in September, we are right now try to get start in October twice a month. We co-over with Health First and the other partner. We start to going back to the school. Next slide. Those are the pictures. Next slide. And we also have outreach programs. We recently did in the Long Island Range. We have 75 patients and 131 service count, and 94 volunteer attended. Those are the pictures. Next slide. There's all the doctors. Surprisingly, we try to send out the notice to all the doctors, and within 48 hours, they get back to us very quickly. So we was worried about those doctors won't show up. They go come up. Okay. And it's a very unique program. Our New York, we do carry on the blood donations. We also know that right now is the season of we need to have a blood drive to supply our local hospital. Next slide. That's the blood drive. Next slide. We also have a bone marrow donor registry, and that was the LA district attorney. They need a bone marrow donations, so we try to find create an event to try to find a match. Next slide. That's the diplomat of Taiwan, and also our CEO Freeman in the picture with all the different community association. Next slide. This is a very unique program. We combine exercise and veggie, and we have diet. We have the 2021 health community projects. We have a virtual exercise every Monday. I believe a lot of people are helping up and join the event. Also, we have
Okay, I saw the group 4 is back ready. Thank you for joining us. Because
所以现在我们回到主编。
好，谢谢。Yeah，
谢谢这个接着是 Steven 师兄的谈。巡回医疗门诊跟 Tima 在这几年来的。
喂 how come the voice when I try to speak and I hear Sister Yana translate? Do I have to do something else?
Sorry, coming off.
Yeah. Okay. All right. Thank you for everybody, and welcome back from the group 4. And today I'd like to share. My name is Stephen Woon, and I'd like to share with the mobile clinic and the relationship with Tima. Especially, as you know, Tima consists of 20% of doctors and 80% of non-medical professionals, that means general volunteer. Okay.
But Stephen, before you get into it, are you sharing the presenter screen? You may want to share the other screen.
Which screen?
It's showing your presenter side. I don't know if you're using 2 monitors. You may want to switch over to. Yeah, you need to switch the sharing to the other monitor.
Okay.
Yeah.
Now, are you seeing?
So you click you click presenter view. That's why you're showing 2 screens right now.
Let me pull out the sharing file first. Okay, now it's better.
Brother Steve, I think you just yeah, you can. Yeah, there you go. There you go. That works now.
Okay. Hold on. Hold on, I'm trying to get out the vote. Okay. So okay. So our medical mission, as you know, is we are always patient center. One of the main goal is to treat patient like a family. So everything we build our program is based on the needs of the patients. And also our medical mission is during the outreach is to learn to be better ourselves. Like I always say, our medical outreach or mobile clinic event is a platform for us to be learn, to be humble, to be better, to be service other people. Is our learning environment for us to be a better city person. Okay, and also introduce a platform to introduce a mainstream to our partner who we are through medical mission. Through medical mission, we can reach out a lot of partners, a lot of community volunteers, and also patients that no idea who Tzu Chi is. And that's a good platform to reach out to them. And of course, mainly is invite them to join our Tzu Chi path, our Bodhisattva path. See? So it's all these things have to come from teamwork. You see, it's a teamwork. And so far, mobile clinic have all these. We have 10 mobile clinics, and 1 is in San Jose, 4 in Fresno, 3 in South Monte, which is in LA, and 2 is in New York. So San Jose is a dental mobile. Fresno have 2 dental mobile, 1 medical and 1 vision. LA 1 medical, 1 dental, and 1 vision. And New York has 1 vision exam and 1 optical exam, optical lab mobile. Those are the mobiles currently we have, and we know that other locations several team are expressing interest of having building a mobile in their region. We are happy to help. You can reach out to us and we can start give you some guideline and see what need to be prepared to have a mobile. Okay. Next is the difference between mobile clinic and outreach. Both are malpractice insurance. Like always have a question about is who protect the doctors. We cover, medical foundation cover the malpractice insurance for all the activities, medical activity in United States. So either mobile or outreach, all the provider working on that day will be covered under our malpractice insurance, which is the medical foundations. Okay. Then the difference between mobile clinic and outreach is mobile is create program and provide continued care. Outreach is create event by event. And also mobiles usually are not suitable for health fair environment. Because of health fair, usually a lot of people come into the event and mobile cannot treat them. So it's usually are not visible to reach out to outreach the health fair environment due to the cost of operation, all those things. Also, mostly and slowly will be all the mobile clinic event are by appointment only. All but we set up by appointment. Majority now, all the mobiles running now is by appointments. No walk-ins eventually. And also all the manpower are supported by local Tima's member, local CG volunteers, and mobile volunteers and mobile staff and community volunteers. And compared to outreach, in outreach setting, they offer medical, dental, vision, and chiropractor all and acupuncture all in one roof, in 1 day or 2 days. And all these are walking type, but both mobile and outreach supported manpower are from the same resource, local Tima, local volunteers, and community volunteers. Okay, and one thing is mobile clinic is easy to reach out to a rural area and fastest time to set up. Initial costs are high, but operation cost eventually is lower compared to fixed location. And also branding, easy to create marketing tool for branding, and also potential apply grants to support the program, because grants usually will provide to organization have program, not have events, you see. So outreach is usually urban, suburban, more equipment and longer time to set up. The costs are only the equipment maybe earlier expensive. Other than that, the cost is pretty much very low. Branding wise, you still can do a lot of branding if you set up the environments with a wow experience and really organize, really impress people. Those branding, you will still can get some grant out there. And apply grant is if they meet the assessment of requirement by the grantor that will impact the committee. A lot of grantors will give outreach too. It all depends on how we can reach out those money. Mobile clinic usually need about 8 parking space with 2 tents and 2 tables and 10 chairs. Pretty much you can set up the mobile clinic. And a mature mobile team usually will continue to increase their fleets to getting more, able to find more money to buy more mobiles in their fleets, and also create more programs to serve the population they are serving in their territories. Compared to outreach, outreach usually take minimum 5,000 square feet size. Usually below 5,000 square feet size are not suitable for mobile ones, because the space with the number of people in there you end up is congested and people feel very pushed to a small 1 square boxes with limited of space, personal space. So I always encourage all the team to have minimum of 5,000 to 7,000 square feet to do an outreach to make it look glamour, more humanistic of Tzu Chi. you're able to present with this kind of location, see? And usually it will take 20, 40 tables and 150 to 200 chairs, all depends on what kind of services you put in under that outreach. If the more services, you may end up with 500 to 1,000. Some of the event I've been set up that we do about 1,000 chairs with 300 tables in there. So those are the things that you can make the experience change for patient, for provider and volunteer. Look at what the difference of Tzu Chi outreach and Tzu Chi non-Tzu Chi outreach. And a mature medical team also will start usually looking forward to buy established mobile clinic. So that means that when the mature teams that have done enough outreach, done enough all these things, they usually are more comfortable to have a mobile clinic or fixed location, okay? And committed team will build strong lead. A community team will build strong event lead to continued care, which is you will extend from every month or every 3 months clinic. You may end up with every month. You will have a smaller event for the patient who used to go to 3 months, every 3 months on your location to have a continued care to be every month now. So all those things are built up from a teamwork that are building setup, okay? So I know 2020 is a pandemic. Everyone's been slowed down, shut down operations. And so the best comparison is I started with 2019 on the overall, the mobile. This is just mobile, not outreach, okay? This is just mobile clinic. We have Fresno mobile, Southern California, which is LA, Northern California, San Jose, and New York mobile. So total of 2019, we do 236 outreach and serving 4,900 patients with 11,000 encounter service. That means a multiple service each patient get. But 2020, we slowed down. Some of the area been shut down, and pretty much we only able to do 61 events with 1,300 patients and 2,600 service encounter. But since January 2021, this year, once most of the team get vaccinated, we're back to normal, quite to normal. And now I think starting this month, we're all pretty much back to normal of the operations. So you see the number will start popping up, like total now is 87 events, 4,000 students, 4,000 patients, and 5,000 service encounter. Okay, so those are the mobile clinic activities. And in terms of professional use, you can see 2019 we used 824 doctors to provide all these services the whole year. And labor hour is eventually 11,000 labor hour. Non-professional wise is 1,300 for 2019. In 2021 now, we have reached so far 309 professional, and non-professional is 708, and volunteer hours is contribute about 5,031 hours so far in this event for this year. So COVID are the one that we slow down, but we never stop. So mobile clinic usually operate with a limited of staff, but with the help of big group of more volunteer, like Fresno, San Jose, New York do have a lot of volunteers. Same thing as Los Angeles. 4-in-1 structure in Los Angeles do come up to help on the mobile clinic in LA. And LA mobile currently is in scope with FQSC lookalike, which means that it's part of the FQSC. So it will be start working mainly with staff operations because of the business, the structure of FQSC. So we'll provide free services, mobile clinic, and charging insurance if the mobile still is in scope with the FQAC lookalike. So when certain event, like for example, LA, certain event we go is a FQAC clinic, then we charge the insurance. If no insurance, we still see them for free. But if let's say we support LA, some of the outreach program, that is not an FQAC function that day. So it's a charitable clinic for us on that day. So everything will be free. So regardless of everything, is either we still provide services, either we charge it or we do it for free. Okay. So Tzu Chi Medical usually have we create a platform. A platform, medical platform is usually give opportunity people to work with the local community partners, and also to build a brand name in the community, opportunity to build a strong medical team, and also to build a strong volunteer groups, opportunity to provide quality care for patients. And to enable you to have a strong team to create a program, you have a self-sustain and able to self-sustain a grant in the mobile and outreach with this platform that you try to build a team. Okay. Somehow I'm not sure why my PowerPoint not working. Okay. And the opportunity to work with the community partners, usually school, non-profit organization, healthcare community, healthcare partner companies and government agency, and usually develop program or let them be part of the community health initiative. And whenever we join those programs or be part of the health initiative, usually they follow with a grant opportunity to support those activities for Tzu Chi. Okay. Then the leverage partner is a community partner, usually provide funding, cost, network, and patient. They will look for patient for us, do marketing for us, and even if they are if we are partnering with hospital or any health clinic, they also will provide provider and volunteers too. So all those things are partners, the benefit of partnering with community partners. When the community partner have benefit of partner with us, Tzu Chi, because they can leverage from us is we have equipment, we have a system and platform, and we are doing a big pool of our Tzu Chi volunteer trained to be doing outreach, and then end up with we are the anchor of the event. It's the main important things. We run the show of the event. Okay, so that way we can put our Tzu Chi humanistic culture into our outreach, show the mainstream who Tzu Chi is, how we treat patients with respect, all those things, and with a beautiful smile of all these volunteers of Tzu Chi. Then what partners look for? See, partners usually look for strong program for the community. And I mentioned earlier, we need to start thinking of looking program, not event by event. Opportunity to be part of the community service. Partners looking at that does the program is part of the community needs. It's belong to the city, belong to the local community. It's not just belong to Tzu Chi. Those are very important mindset have to be in thinking of doing a program. Then allow to help solve the community needs. As we need to know what is our local community needs and what local need. We cannot say that, oh, because of Tzu Chi like to do this part of program, but the community don't need it. And we still enforce it. And usually they end up with nobody will join those programs or will not be successful. Okay. Program only successful when the local community are involved and the need is there. Okay. And a solid and trustworthy organization like Tzu Chi, people other partner will always like to participate and be partnered with. So opportunity to build a brand name in our community, create brand name through
I just took a walk.
Create a program that community partner can be participate in volunteering and provide funding to benefit the local. So when they have a see opportunity and brand program is good, they usually will participate and try to help those programs. And must be aware of what your local needs, like I mentioned before. Usually, let's say LA or all the big city or big county, every 2 to 3 years, they have an assessment report of the county or the city run by health department, hospitals, and also the city of your place you live. And those reports will tell from housing, employment, and also for health issue. When I usually look at the health issue side every 3 to 4 years, the new report come out, see what's the need there. Then we create program surrounding that needs to fulfill the gap of the need in the medical care. We also call it access help, you see. And most grantor will be available based on those program needs reports. See, usually there will be grantor will purposely create some funding to cater the needs and let other organizations will come and apply for those based on those reports. So remember that once those assessment reports come out, you look at it, they always come with opportunity monies to apply grant for that. So those are the things like Fresno, just as you know, some of you know that we just in Fresno celebrate the 20 years, and they already reached, this Fresno team reached 1,000 events this year. Due to COVID, if not last year, they already reached their 1,000 events. And it takes a while, commitment of these volunteers and Tima volunteers and community partners to pay and join force with the Fresno team to reach these 20 years and serving over 1,000 events. And they create $21 million of market value and volunteer contribution hours to these 20 years to the community of Fresno County. See, in medical service, dental, eye care, acupunctures, and all kinds of services that they have. But over the years, they build their program. This is their program for everyone reference and what I'm trying to say. Under this platform, they care for Healthy Fresno. They have sister town, Healthy Sister Town for the rural area, Healthy Fresno for the urban area, and senior, we care for the senior program, which is 2017. In Fresno, they say that there's a very niche program, population that senior do not have a proper dental care and vision care. And this program is catered to vision and dental for the senior in Fresno County. And C2 Success, same thing, is catered for pre-K to 3rd grade children eye care in the school in Fresno County. And so Highway 99, we go out all the way to Sacramento, IK20, Smile for You, and our migrant family is the latest migrant program that we started with. We'll work with Fresno County migrant program for this program. See?
You know, when I was out at Kermit, and some of the students, I mean, we're talking little kindergarten, 1st grade, 2nd and 3rd, and you know, as some were getting dilated, you know, or they were afraid to get that eye drop. They were like, no, crying, and you know, the team was just so passionate and made them feel comfortable to the point where they got their shot, they got their drops, relaxed. They were even, I think, I think it's part of the whole vision process, but it just looked like games because they were saying, can you point here? Can you see this? What is this? You know, glasses with one, so, I was taking pictures of them, and some of them, wearing their one-eyed glasses, and then when they put their vision glasses, once they get dilated, students, they were happy. They, as they were going through the process, I love the process that Tsuchi has. The stations from the beginning to the end. And, seeing the end result of the students, I remember a young student, again, from Kerman. And, there's, towards the end of the stations that Tsuchi has, there's a display of glasses that students can choose. So students' choice of a pair of glasses, whether it's blue, pink, black, whatever it is, I mean, they're so flexible, bendable. Parents were even saying, no, I don't think my kids are ever going to break these glasses. And, seeing that student, come in and say, hey, mister, I can see now. Was very touching, because if it weren't for Tsuchi being at that clinic, being at Kerman, at that site, who knows when that student would have received a pair of glasses? Who knows when that student would have been identified as needing glasses? Because like I said earlier, some parents, it's difficult. They may never come to Fresno, or they may only come once in a blue moon. But because of that event and because of that clinic, that student had that opportunity to receive glasses, and the parent was so thankful. And I said, don't thank us, thank the Tsuchi Clinic and their providers for what they do.
Well, this is the our partners talk about our programs. That's why what I mean is we have to create programs that really impact the communities. See? Because of the create program will give opportunity for Tsuchi. Like, for example, Kaiser donated a brand new dental mobile for the community. These are $650,000 mobiles. That is our number 10 mobiles in our fleet. See? And also the community clinic, community partners will see the work of Tsuchi. They will help to subsidize the cost of operation to Tsuchi to help out the operation. Kawiwa continue donate, like this year they donate $100,000 for the C2 Success program to help the children with eye care. See? So all these things are important when we create a program. See? And also opportunity to build a strong team is with the more programs serving the community, we need to consider a team that a consistent medical team to support it. So the medical team should have a teamwork mentality, positive thinking, commitments, and mindfulness. And also with the strong SOP to set up the standard and the services to ensure the quality care and ensure the Tsuchi image. See, positive volunteer environment. We want to make sure we have that kind of positive environment for volunteer, and also have a attitude of our responsibility and can be done attitude. See? And always big dream. I always say we always should have a big dream. Big dream move forward with the hope. When there is a hope. Team stay put when there is a doubt. And the goal is, and our goal must be realistic and simple and achievable, and one that can be benefit the community. I continue stress to everybody that everything we do is for the community. Everything is based on their needs, and build our programs surrounding with that. Just like same thing as patient. Our medical mission is patient-centered. See? And also opportunity to get a strong volunteer group. Usually, we try not to beg or spoil people to volunteer as provider or non-provider. People naturally join us due to the respect towards the mission and program. Okay, instead of begging, why don't we inspire them with the mission, provide a strong professional and friendly environment, and experience the joy of giving. Respect towards the medical missions and program, we will gain them. Okay, so let's listen the volunteer that have we able to inspire them.
And I want to say, tNTVY has taught me a lot. The one thing that sticks with me is we all have another gear. When you think that you are maxed out, when you think you can't do it anymore, when you think you're just used up, no, we do have another gear. And tNTVY helped me find that gear. And with that extra gear, I'm going to contribute everything I am to staying involved with tNTVY and moving forward, because where they go and they leave footprints, there's nothing but goodness that remains behind.
When Olivia calls and says, "Can you please?" I try to say yes every time. We've all heard when E.F. Hutton talks, everybody listens. When Olivia or Steve talk, we all listen. So if a friend calls you and says, "Can you?" and you hear the name tNTVY in it anywhere, please say yes, because it will change your life and the lives of many other people. Thank you.
So those are the things that are supposed to be, you will have a long life of commitment of this volunteer when they feel inspired. But also at the same time, we as a professional one side, remember we say 80% are non-professional from in the Tima and doing outreach or mobile. The non-professional side also need to do the job is to make sure to inspire all these providers that you have a nice place to work with. You have a top of the line of the equipment that you use to make them comfortable to practice what's the best for them to treat patients. So like when we this Healthy Friends event nicely coordinate and people line up in orders, all the table be set up. Those are like nurses come out and say, "Wow, this is very impressive and clean and neat, not all boxes or laying around all those things." See? All the patients come in to sit down nicely and chair in orders, and it's not nicely labeled so that they don't get lost what to do, where to go, all those things. And the dental chair are nicely lined up in order. See? So provider and patient will look like, "Wow, this is really nice." See? And same thing, look at it. This is how the waiting room is when they have each department have their own waiting room, but this is the main waiting room before they go into each sub, like going medical or dental, acupuncture, pediatric, or vision. That before they go to those separate. Think of it, you are in the hospital, a big room before you go to the small room in each department. See. So in the smaller places, like smaller team that don't have do big event, when you do a small event, same thing. It's too nicely table organized, line up, all in order, all those things. And one thing, like I say, community volunteer is very, very important in our system in doing outreach. Okay, or mobile clinic. Our source of community volunteer usually are from college students, high school, community partners, and general volunteers, besides our own tNTVY volunteer source. And we also are able to provide internship, mobile clinic projects or outreach. See, so sometimes from this group of volunteers, they end up with is a commissioner in training, all these things. Like in this picture you saw on the left corner where the RN wearing a white polo shirts, Susan Chen. She's a this year she will be the Tima commissioner, certified commissioner. See, because of she's first walking to our Healthy Friends in 2016. Was so impressed with her. She was impressed with all the work all these volunteers do and all this. Our mission, Tzu Chi mission, is everything from then onward. She's non-stop, continue volunteer and never fail, not showing up to volunteer. So these are look like when you deal with local community volunteers. Those are volunteers, not patients. See, these are local community volunteers. These are the local volunteers in the big event. They line up at 4 o'clock morning because the event starts at 6 o'clock morning to 6 o'clock p.m. They come in at 4 o'clock because we do orientation on the day of the event. So everyone come in early, get used to know where all the things are and the floor mats, all those procedure. Same thing, check in all these volunteers, make sure they sign in all those things. Those are when they don't use computer. Now we use computer to check in all these patients and volunteers to sign out so they can keep track their volunteer certificate and volunteer hour for future use or on the spot. We will when they want a certificate for volunteer for that day after they clock out, then end of the day we'll email them the certificate of volunteer to the email. Yeah. So we use a lot of interpreter, like some of those area, most of the area do use medical interpreter student to help to interpret. These are medical interpreter student from college and not just regular volunteer who speak Spanish. There's volunteers, and we use volunteers to help out to fill up application because California more have a Latino, Hispanic, and we do need this local volunteer that can speak the language to help to fill up the application registration form, because we try is as Chinese, sometimes we have to roll the tongue, so the pronunciation is always not the accurate way. So opportunity to provide quality care to patients is continued care. And we create a referral service to specialties and add more services. Like if some team have only do medical, now they decide to add vision or dental or anything. Those are the services when your team continue to grow, your program continue to grow, see? And our team that continue to grow will always, every year, will have some new program added into their system to ensure the patient have more choice or more services to add into their care. Presso, Tzu Chi is almost like a one-stop shop. Every patient comes to us, we should be able to provide dental care, health, medical care, acupuncture care, vision care, and what did I say? Medical, dental, vision, and acupuncture, yeah. So, and some do have a mammogram, and also all the lab tests. Lab tests will come back to the team and review all those things. All these things are part of the growing, the medical team grow to continue to provide better care. I remember when I first started 20 years ago when a medical mission in Fresno, we have nothing, pretty much patient come in, see, that's what we have to offer, just consultation. But now they get more service from lab, mammogram, and vision, dental care, everything that we can provide, will offer to the patient their needs. But also same thing, mobile clinic, because of it's part of medical foundation, we do have a structure, SOP, standard, all those things. We try to train all the team that need to be trained, deliver the same message, same mission, continue training, continue education, and try to do simplified method to do things. Don't make it so complicated. and we standardize all the procedure and build common mindset. That's very important. Once everyone have a same common mindset, then the medical team can continue move forward. So we do boot camps in Fresno, 2-day boot camps. Those are boot camps we teach teamwork, mindfulness, commitment, SOP, and about grants, all those things. And the team from the Central Valley and Northern California will come and join the training. And we do teach them how to identify their problem and doing the SWOT analysis, all those things to understand their own program, what's the error, what's the need to be improved, all those things, see? Then also hands-on training on identified tools, dental tools, simplify it so that easy to volunteer to learn and easy for doctor to practice, see? Then also vision on hand, how to do the vision, how to handle the vision equipments, how to doing testing for student, all those things. Then also we do go up to New York to train. This before pandemic is the 5th years. Last 2 years we never unable to do it because of COVID. And I hope next year we start back going annually 2 days training in New York. Then we do same thing, 2 days, all identical training like in California. Then like San Jose also come up to learn all the EHR training, all the software, data collection for patient chart. Then Las Vegas also start doing all this team building. And with that mindset, they really have their own vision equipment. We're able to do vision services in Las Vegas without a vision mobile, except only unable to do make glasses on the spot. That Fresno Vision Mobile will support them with that support their vision, their eye classes. So these are the training that been provided to them, all the equipment. And they did it one time before COVID. And right away, within 48 hours, we send back all the prescription with the glasses case and the lens cloths for them to deliver to the patients. So same thing, during certain time, mobile do help the, disaster time. San Jose Dental Mobile go out to the Chico fire to help out all those things. So, and also this, what you see is all this dental service with, I believe those are even the local volunteer dentists able to help along with the Tzu Chi dentist on the mobile. So during COVID time, a lot of people shut down, but the mobile still moving on. So vaccination is one of the things that the mobile clinic can help, but of course, without using the mobile, because of when vaccination need a lot of bigger space, move more people. So we still doing like, it's under mobile clinic, but still do vaccination using outreach format to use it, to operate. So we, Fresno Mobile Clinic do rural area vaccinations and provide school. And now we just committed another 50 event vaccination for school and rural area, starting October to next year, 50 vaccination clinics. Today we are in San Joaquin, agriculture town. Primary is a farm worker and a migrant worker. This program is especially for migrant worker COVID vaccinations. My name is Stephen Woon. I'm the Executive Vice President for the Mobile Clinic for Tzu Chi Medical Foundation. Early morning, every event I have to go to the centers to get the vaccine. Instead of using a portable cooler, we bought a refrigerator can plug in the car, so maintain the temperature. Because of the vaccine is very delicate with the temperature issue, and because of the rural area take about 1 hour one way to the location. We are glad that we partner with St. Anna's to make it happen.
We've been partners for a long time, and Suu Kyi has always been the provider who can very quickly mobilize volunteers, nurses, doctors. Today we are in San Joaquin. It's one of the most unincorporated areas in Fresno County. It's got a population of many ag workers. They're in agriculture, people who don't have primary care, and who really can't get out to metropolitan Fresno.
Mi nombre es Ana Mendoza y mi esposo y 6 hijos. El día de hoy estamos aquí y recibimos la vacuna, yo y mi esposo. Aquí vivimos en San Joaquín. Venimos caminando porque mi esposo ya no maneja. Entonces para nosotros es más fácil que esté cerca. Para nosotros fue excelente.
My name is Suzanne, and I'm the lead RN for Suu Kyi. I retired from nursing in 2017, and actually I've been feeling quite guilty that I'm not in the front lines with my buddies who are still there. So on Monday, we went to San Joaquin and we did 275 doses there. And today we're at Easton. It's just on the outskirts of Fresno. And today we have 347 people coming through. The clientele are mostly agricultural workers. They're also underserved out here. So it's great that we're able to travel and come out here and make it more convenient for them to get to us. They don't have to travel as far.
A lot of migrant workers here, they don't have healthcare insurance, and everything that we give today will be free, and we don't charge them anything. So everybody has the chance to get a vaccine.
We are committed to do 3 times a week, every week. Hopefully we can expand using this module of mobile clinic to expand to Los Angeles, Northern California, New York, where we have mobile clinic can pick up the same role with other partners and do the vaccination.
The patients feel like they won a lottery. They feel like, that there's hope for the future. They feel seeing a light at the end of the tunnel now. They're all very happy to get it. They are just feeling a little bit more relieved. They walk out of here more confident. So we'll continue to come back until the people don't need us anymore.
I will feel nice that the people that came from far away, because if they were not here, we're never gonna get it. So I'm glad for you guys. Please, people, if you have a chance, if you can guys come and get the vaccine, it will help all of us.
So those are the videos that we just shot this year, what our program is. So we do go out to the factory. Fresno County have a lot of rural area where have factory, or doing garlic, canning, processing, all those pecans, all those things, product. And this is a guest worker from Mexico that arrived, so we help them, vaccinated them as much as we can with vaccine, so that to ensure they are safe, and so to ensure the citizens of Fresno safe with all these guest worker. See, then we do inside and outside. Inside to do vaccination walk-in and pre-appointment, and outside is a drive-through for those people have handicap. We do in all kind of environment. Night, sometimes we have to left over some doses. We have to work late night to make sure finish up all the vaccine. And also we do it in the school, field, and participate basketball court to and able to cope with all these large group of patients. And also we do home vaccination when we are there. Sometimes some patients are unable to come. We send our provider to go to the house and vaccinate, do the vaccinations. I think part of this is very important because if we don't do this home visitation vaccination, then they unable to go out to do it. So I'm glad that our team able to do these home vaccinations. And same thing like this one, they come to our site and say that their husband at home cannot come out. The ladies look very healthy. She's 90 years old, husband is 80 plus. And we walk there, some walk a mile from the location to the house to give vaccination. Sometimes for them say, oh, 1 mile is very close. Oh, they say very close, but we end up with 1 mile. We never thought like, oh, 1 mile, that's in hot heat in summer is very, very difficult. But for them, they used to. For our volunteers, like it was a big surprise for them. But it's like I say, it's a platform learning. It's a learning of to be better ourselves, to be grateful what we have. And I'm glad that mobile clinic and medical outreach provide this platform for all of us to be grateful and humble and able to provide better service for people who are in need. And thank you very much. And hopefully I didn't rush my presentation too fast, and I'm still ahead of a bit time for you guys to catch a break. Thank you very much. So I guess it's going to be lunchtime unless you guys have questions.
Yeah, I do have a question. Can you provide your PPT and also this video presentation for our doctors? Yeah.
Let's see. And you are Jonathan Yang or who's that?
Okay, and this is Ren from Phoenix.
Oh, Phoenix. Yeah. I can share my PDF file, and I send some of the videos in 360. I will try to give you the link later. Yeah, and I know Phoenix, you guys are trying to do medical outreach more, and like I say, Medical Foundation are willing to help as long as you can ask us. We can provide training for you guys. Okay.
Okay, thank you very much.
Stephen, hi, Stephen.
Hi, Dr. Cheng.
Yeah, thank you so much for, excellent presentation. I have one question, after your mobile clinic or, medical outreach, do you have a regular, clinic or community clinic in Fresno area to get a regular follow-ups for your, all these patients?
We do follow up some of it from outside, refer in the rural area, but in our location, we do have our clinic, Tuesday clinic, to follow up some of the patients regularly for those who need hypertension, medication, diabetes patient, and some other mild medical needs. We do see them in our Tuesday clinic in our location.
Okay, some patients need a specialist or referral service. For example, you found out that heart problem, heart murmur, heart failure, and also like a surgical case, abdominal mass or something. Where do you refer to these cases?
We usually, our doctor will have a list of referral area. We refer to some of the FQSC clinic to follow up, and some of them from there, they will join and in the system FQSC from the local in Fresno area, then they will refer out to their specialties. Like for vision, sometimes we refer, and sometimes we can able to get our partners, some of the big eye institute partner do some free service for them too. So like our vision program, the See to Success, we've been doing that for since 2016, and we so far only have one cases that need eye surgery. So our partner pick up that patient and provide free surgery for that child. So those are the things that's why I say we need to build up all this network of refer that we can pass the patient to them and they will handle it from then onward. But we also have started having like, once we pass the patient to them, we do follow up with the provider, see did the patient show up with them and how's everything goes, all those things. Then the provider usually will let us know how's the situation of the patient under their care. So those are the things that every team need to start working on these kind of things so that we can solely comprehensive care for them through us or through partners.
Yeah, how do you look for that kind of, referral center? Do they charge money or do you need to refer to the county hospital or government hospital?
Some will have charged with a minimum. Some do take Medicare because most of the under Obama affordable care now, most of them have insurance. They will have a program. So a lot of partners have programs that fit into there. Like for example, we just started a mammogram service for free. But technically that partner come into our location for mammogram, but they have a funding from No Woman Left Behind, that grant. So if that patient that we put, they come to our location, we schedule all these women for appointments for that day. I think it's about 25, 26 appointments a day. And if that patient do not have medical, they will be funded by the women's No Woman Left Behind grant. If they have medical will pick up that. So eventually that patient get the mammogram service is 100% is free. So those are the things that the team need to know where to look for and who's the partner that can provide all these things, then so that to benefit the partner, the patient. That's all. This is extra work for our end to make sure we have this lineup for them. Yeah.
Another thing, regarding about branding and marketing, or Tsuji, there's community health center or community mobile clinic or whatever. How do you promoting, to the local area? How do they know, that what they will have a mobile clinic, people will come. How do you, inform them ahead of the game?
It's all come down to network patients and volunteer, because when early days, even Fresno do not have a mobile at that time. We do a lot of outreaches and we do 18 times, I think, minimum of outreach a month, every month, and some are twice a month, then plus every week clinic. Then also through that, the message will deliver to like the social services. Fresno County will hear about it, then they come to us, say what you guys offer. They want to know the unemployment benefit. Also come to us and say what you guys do. So we explain to them already. When those clients they need service right away. They say, okay, they print out their flyer from our website and give it to them. Say, here's this guy located at what location. You go see them. That's how we do when in early days, which I think most of our audience are in that stage right now because that you guys don't have mobile. So you need to build up the relationship with the health department, county, social service department, all those things. They know from the words of mouth, people start know what we can do. Like for example, See to Success is a vision program that they approach us to be part of their program initiative in Fresno County. That's why end up we choose the name C to Success. Before that, we really planned to have the vision clinic, but we still haven't find the niche yet until this children movement heard about us when some other partners tell them, why you guys create a wheel when you guys can go look for Tzu Chi? They come and approach us. That's how we join venture and end up with their fully support with grant money, everything to support this program. And we have Fresno County 30 school district. 18 school district is under this program and is calculated to 70% of the school is in this program. So it's all come to network and talk to people, and people know who you are. That's why I say, before people know who we are, we need to do our job to present to people who we are. We are professionally managed outreach. We are very Tzu Chi humanistic side of it. So people have confidence of us to do it. Yeah.
My last question, how do you recruit the volunteer doctor and then volunteer, non-professional people to do all these, like charity, mobile clinic job or outreach? How do you recruit to get like more and more, expanding your Tima, outreach business?
On recruiting provider is through word of mouth among their provider. And like I mentioned before, you need to inspire our doctors to continue come. Once they come, they really know this is the home for them to do good deed. So our part as non-professional like myself, I need to prepare the platform for professionals to enjoy every time they come and work, volunteer in Tzu Chi, leave the end of the day with happy feeling. That's how we make sure this criteria included our volunteer, non-professional and professional. That's why I can't emphasize, make sure we inspire them. By inspiring them, you have long run. All our doctors, some of the doctors they see just on sharing at least 5 to 10 years with us already. And Fresno Tima doctors, we only have 3 doctors speak Chinese. The rest of our doctors are non-speaking Chinese, and they are all Americans. Okay, so thank you.
Thank you, Stephen. Excellent presentation. Thank you so much.
You. And I think my time is up already. We're ready for lunch now. Thank you.
Thank you.
Thank you, Brother Stephen. Thank you very much. Following Brother Stephen's presentation, we're gonna join everyone for a lunch break here. Please join us back at 1:10 to resume our afternoon program. Our afternoon program here includes our book sharing club seminar for an hour, and then we'll have the closing ceremony for the US portion of the Tima convention. So please join us back here at 1:10 p.m. Pacific time. Thank you, and we'll see you soon.
Thank you.
衷心地表明，我的生涯是服务人
有人以谦卑奉献和教诲，
我将尊严而立心，以病人的健康为一切的优先。
我将尽力而为，维护传统的荣誉和尊贵。何处需要抚慰，我们竭力爱，翻山越岭，翻山越岭。
何处需要关怀，
我们漂洋过海，不让爱枯竭。追随上人的慈悲，让苦难人间化作流离的世界。我将付出一切，发扬慈济医疗事业的光辉。守护生命，守护爱，守着人间的慈悲，让自己的医疗成为日不落的世界。因为奉献了一切，因为无怨也无悔，让卑微大遗忘，都是照亮大爱的光辉。
何处需要抚慰，
我们竭力爱，翻山越岭，翻山越岭。何处需要关怀，我们漂洋过海，不让爱枯竭。
追随上人的慈悲，
让苦难人间化作流离的世界。我将付出一切，发扬慈济医疗事业的光辉。是 心地表明，我的生涯是服人类。我尊敬和感谢所有人以谦卑奉献和教诲。
我将尊严而立心，以病人的健康为一切的优先。
我将尽力而为，维护传统的荣誉和尊贵。何处需要抚慰，我们竭力爱，翻山越岭，翻山越岭。
何处需要关怀，
我们漂洋过海，不让爱枯竭。追随上人的慈悲，让苦难人间化作流离的世界。我将付出一切，发扬慈济医疗事业的光辉。守护生命，守护爱，守着人间的慈悲，让自己的医疗成为日不落的世界。因为奉献了一切，因为无怨也无愧，让卑微大遗忘，都是照亮大爱的光辉。何处需要抚慰，我们竭力爱，翻山越岭，翻山越岭。何处需要关怀，我们漂洋过海，不让爱枯竭。
追随上人的慈悲，
让苦难人间化作流离的世界。我将付出一切，发扬慈济医疗事业的光辉。我 的生涯是富人类，我尊敬和感谢所有人以谦卑奉献和教诲，
我将尊严而立心，以病人的健康为一切的优先。
我将尽力而为，维护传统的荣誉和尊贵。何处需要抚慰，我们竭力爱，翻山越岭，翻山越岭。
何处需要关怀，
我们漂洋过海，不让爱枯竭。追随上人的慈悲，让苦难人间化作流离的世界。我将付出一切，发扬慈济医疗事业的光辉。竭力爱，翻山越岭，翻山越岭。何处需要关怀，我们漂洋过海，不让爱枯竭。
追随上人的慈悲，
让苦难人间化作流离的世界。我将付出一切，发扬慈济医疗事业的光辉。
衷心地表明，我的生涯是服人类。我尊敬和感谢所有人以谦卑奉献和教诲。我将尊严而立心，以病人的健康为一切的优先。我将尽力而为，维护传统的荣誉和尊贵。何处需要抚慰，我们竭力爱，翻山越岭，翻山越岭。何处需要关怀，我们漂洋过海，不让爱枯竭。追随上人的慈悲，让苦难人间化作流离的世界。我将付出一切，发扬慈济医疗事业的光辉。守护生命，守护爱，守着人间的慈悲，让自己的医疗成为日不落的世界。因为奉献了一切，因为无怨也无愧，让卑微大遗忘，都是照亮大爱的光辉。何处需要抚慰，我们竭力爱，翻山越岭，翻山越岭。何处需要关怀，我们漂洋过海，不让爱枯竭。追随上人的慈悲，让苦难人间化作流离的世界。我将付出一切，发扬慈济医疗事业的光辉。
衷心地表明，我的生涯是服务人类。我尊敬和感谢所有人以谦卑奉献和教诲。
我将尊严而立心，以病人的健康为一切的优先。
我将尽力而为，维护传统的荣誉和尊贵。何处需要抚慰？我们竭力爱翻山越岭，
翻山越岭。何处需要关怀？我们漂洋过海，不让爱枯竭。
追随上人的慈悲，让苦难人间化作流离的世界。我将付出一切，发扬慈济医疗事业的光辉。竭力爱翻山越岭，翻山越岭。何处需要关怀？我们漂洋过海，不让爱枯竭。
追随上人的慈悲，
让苦难人间化作流离的世界。我将付出一切，发扬慈济医疗事业的光辉。
Hello. Hi, everyone.
Hello.
Are we going to start? When they are going to start?
We have 5 more minutes.
5 more minutes. I think it's 1:13:10. Right now it's 1:05, so we still have the 5 minutes.
5 minutes, yeah. Say hello to 他啦，你的先生，师兄啊。
Hello, Jonathan.
Yeah.
志倩。
对。
Yeah，他在5分钟。
对。
谢谢。
OK， 不客气。
你们是 Northwest 在哪里啊？
他们是北加，San Jose。They are from San Jose, Dr. Chang.
San Jose, OK.
Yeah.
San Jose 那边的麦老师在吗？麦老师
啊，我没有在学校里面，所以我不。
没有啦，那个廖医师，那个Mike 廖，是不是？
对，做针灸中医的。
你是人在哪里？
I'm from New York.
OK 的，好啊。
上线了 ，OK，
Dear Tima Annual Convention participants, welcome back. So now we're gonna continue with our afternoon course. First of all, we'll be continue for our first course book club sharing. Please welcome Sister Mary, Dr. Lin Anlin, and Sister Audrey.
Hello， 哎，有了。
好了，看不见。好，我们现在开始我们的品书会，在线上你们看到，那边的慈师是不是还在换衣服？非常非常感恩哦，我们等这个 moment 已经等了很久。那今天呢，就是因为我们的团队大家的努力跟坚持，那我们才有机会在线上跟大家相见欢。那我们今天在现场有16，我们现场其实有9位，可是呢，他们都身兼数职哈，像 Clarence 还有 Monique 还有 Lian， 他们都在后台还在 host， 所以没有办法来跟大家会面。不过我相信在 room 上哈，在 room 上会相见欢，对不对？那我们这个读书会，我想很多人都知道，是因为去年10月我们回到台湾，感恩我们台湾的仁医会的法亲们邀请我跟葛师兄去参加他们的一个读书会的圆圆。那我们看到非常的感动，所以呢就成就了我们今天大家可以坐在这里。那我们在今年的1月就已经展开了我们美国仁医会的读书会。在这个10个月之间，我们的团队有10几位的 core team 哈，大家非常的努力，所以我们坚持到现在才可以坐在这里跟大家分享我们是怎么样在运作我们这个读书会。那上人一直跟我们讲说，要常常传法说法，要结好人缘，所以在过去这20多年的慈济路啊。那我从懵懵懂懂，贡高我慢的这个女强人，自从接入了慈济以后，学习到上人教导我们的感恩、尊重、爱。那我开始慢慢的了解到，我开始放下我执，开始缩小自己，那开始真正的融入了我们的慈济的大家庭。那很多人都说20多年来你们这样子的付出都不觉得累吗？那我要跟大家分享，真的没有觉得累，因为看到我们所有的法亲大家都互相协助哈。那我们今天这个仁医会，我们也今天已经快要到尾声了，可是我也想借这个机会，真的要感恩我们读书会的成员，真的大部分的成员都是我们这个仁医会的 core team。那我们大家一起成就了很多的慈济事。那我们从不懂到懂。那我们等一下呢，我就想一一的来跟大家介绍我们的读书会，我们的品书会，我们是怎么样开始的。那我们现在呢，可不可以请庆庆师姐哈，她跟大家分享一下我们的缘起。好，那我们庆庆师姐她的缘起。我们的影片还在播出了吗？好，还没有播出之前呢，我再跟大家分享一下，在这个读书会哈，我在台湾遥控，当我看到全台湾的读书会都遍地开花的时候，那我第一个就打电话给庆庆，我就说我们美国这边我也很想，那结果他就马上联络，其实我们线上有好多我们的 core team 哈。那因为时间的关系，我们没有办法一一介绍。那我们的影片可以放出来吗？
没有声音。
开始，各位敬爱的家人菩萨，大家好，我是美国
周希洛志工，也是医疗志工周庆庆法号绿化。我今天想来分享一下我们美国医疗读书会成立的始末。2020年，葛师兄跟 Mary 师姐人在台湾，他们受邀参加了很多当地的读书会，看到大家遍地开花，他非常感动，也很羡慕，所以他就私讯我说，庆庆啊，我们可以来成立一个美国医疗读书会。刚开始我们根本懵懵懂懂，他人又在台湾，我们就这样子在1月初成立了医疗读书会。我们现在的成员有将近100位，然后每周平均上线的有50位，来自各地不同的地方。除了本地之外，我们还有来自凤凰城、拉斯维加斯、北加州、台湾的医护人员及大医王们。我们要非常感谢台湾的新许老师跟新碧老师，在一开始指导我们，让我们从懵懵懂懂的读书会开始，到现在已经慢慢渐渐有雏形了。在此要非常感恩大家的参与。那我也祝福我们美国医疗图书会能够日渐茁壮，长长久久。我相信我们可以做得到，因为我们有上人的法，一定有办法的。祝福大家福慧双修，法喜充满，阿弥陀佛。
哇，我们庆庆他每次都说不要，我不会分享，可是他每次分享的都非常令人感动哈。那个葛师兄也可以跟大家做一些补充，我们来听听看葛师兄。那我们今天为什么有一些是用录影的哈？是因为当初想到我们有10几位成员，怕大家上下我们音控可能会来不及，所以呢都事先做了准备。好，我们听听看葛师兄的分享。声音。有声音吗？
去年何其有幸啊，在台湾参加台湾人医会的读书会，那个时候台湾各地都是品书会遍地开花，都非常的敬仰跟非常的羡慕，他们能够那么欢喜的大家一起来读书。那个时候就想说，我们美国何其有幸，有那么多菩萨在医疗基金会还有美国的人医会在一起共事。如果能够一起来读书就好了，因为我们何其有幸在慈济做事。
De la sabiduría
以上人
en el ser humano nos acumula sabiduría y nos da el entendimiento para seguir firme en la belleza de la bondad.
以佛陀的例子以及当代的一些状况来作为实例讲解佛法的精神。那我们
¿Qué es lo requerido de este club de lectura?
这个思考，把实际的精神理念那个 core value 能够抓住的话，那最好的就是读书。
La capitana del libro de lectura es la doctora Lina Lin. Es un camino largo donde vamos construyendo sabiduría. 20 años atrás en Suchi he sido voluntaria por muchas décadas, pero no hasta el 2014 cuando fui directora del programa.
告诉我们的故事里面得到里面的精神那我们和互协在一起工作就非常的值得。所以我有一个 dream 就是希望大家都能够来品书，所以我们的目标就是每一个人都来，而且每一个人都是欢喜的读书，法入心，法入心，法入行来一起为我们美国医疗事业打拼这个是我的 dream，也非常高兴的，我们一天一天都朝着这个方向去做，感恩大家。
No empecé. No había empezado a escuchar las sabidurías del Master Chen Yen confrontando al público representando a Sushi.
好，那我们接下来要跟各位分享我们这个领书会是怎么样开始的。当我们大家有了这个共识，我们要成立医疗人医会，那我们就菩萨涌出啊，我们就出现了一位我们的梦洁医师，他自动愿意来承担班长。那我们请那个梦洁医师跟大家分享一下你这个一路走来的心路历程。
感谢师姐哈，是非常感恩哈，我不知道是不是我自己要当班长的，不过对，那我从911开始以后哈，就是正式的加入慈济哈，这个20年。
Yo tenía miedo de ser llamada un shorturl。
其实以前哈，在很早以前，葛师兄和妹师姐他们在带那个无量易经的时候呢，那时候我已经有参加了哈。那最让我记得一句就是说，我们慈济的精神就是付出无所求，还要有感恩心哈。那可是呢，很可惜我当了快乐志工当了很多年，然后真的回来的时候，就是当然是911，但是从2014年哈，因为是要负责当大爱车的主任哈，所以就是不得不，我觉得好像要听法哈，他正好刚好那时候熏法香也开始，那我就开始熏法，因为我觉得说我们要代表慈济出去外面的话呢，我们是一定要有慈济的威仪哈，那要给人家看到的，会觉得说，哎，我们是有慈济人的风范哈，也希望可以影响到别人。那在家里的话呢，因为我也是一直想要把自己做好，所以呢，才不会被爸爸妈妈说，哎，不要去慈济了，哦，因为家里都没有管好啊。那有一次哈，就是从义诊回家的时候啊，那很累，然后又很饿，那时候我就想啊，终于可以回家了，因为自己开车哈，开1个多小时，然后整天都就是看眼睛看诊哈，看了整天，那回家一定有好吃的东西哈。那小孩子都是一定很乖啊，哈，然后那就是我先生啊，哈，但也很会煮菜。我想说啊，他应该煮菜，煮的桌子都菜都准备好，等我们来吃饭。但是一回家的时候一看，哇，他就坐在那边，然后饭也没有煮，那小孩子都在那边玩电脑，然后就大家都好像在自己做自己的事情。那我就突然哇，火就上来了，就很生气，我就跟他大吵一顿哈。那时候小孩子才23年级，23年级，那所以那时候我先生就很生气，他就说，你都一点没有感激我就是他觉得好像没有被 appreciate 的，那他就说他要去我公公家这样。那还好那时候他也是没有出走，离家出走。那不过呢，那时候小孩子23年级，他们到现在6、7年以后，他们还是很记得那一天。那尤其是疫情来疫情后1年多了嘛，刚开始的时候呢，大家都是闷在家里面，那开始就是一定是心情很不好，然后就是在这个小小的空间，开始有时候就是会有难免会有口角、会吵架。那但是还好，就是那时候开始就是天天在熏法，从去年在4月、5月嘛，比较晚一点那但是那时候开始熏法，那从熏法之后呢，开始自己安定自己的心那觉得说要开始就是说更学习，在那个时候一定要更学习自己要安静要有一个要 calm 一点然后要多一点的正向的思考，要多一点感恩那所以呢，就是那时候上人说茹素，那我本身是已经吃素吃了7年了，那但是呢，那时候我也是跟我的先生说，那我们就一起来，还有家人说一起来吃素吧。那他们就是有好几个月都是跟我一起吃，至少2餐的素。然后呢，那本来我先生其实是很喜欢 barbecue， 很多师兄师姐大家知道。那他现在也是减少了很多，根本很少。那我真的是有觉得，就是从多吃一些素之后呢，就是他的脾气比较不会 这么的，好像一下就生气这样子，真的是有平和了很多哈。那就是真的是有这个上人的法。那经过，虽然我在那个实际当 Vision Mobile 的主任当了7年了哈。那我其实到那个 Fresno 我从来都没有去过，所以错过了很多的像2018的 Tima， 还有很多的 training。那大家都一定觉得说，为什么你是主任连去都没有去过 Fresno？ 那我今年终于他们的20年周年庆我去了哈。那是因为是我终于有受到我先生的祝福哈。那也是非常非常感恩他。还有我的家人，那所以呢，这就是我想这是上人讲的哈，我们就是说听法，然后要身体力行哈，然后自己感觉到了，然后可以别人也可以感受到哈，那这就是我熏法的动力哈，希望可以把自己改正哈，而且呢能够影响到别人，感恩。
好，那我们。有了班长，有了团队了，那我们现在开始要读书会了哈。我记得我们是在1月7号就开始的。那我要非常感恩我们下一位哈，黄美英，她协助我们串场，还有帮我们出很多的导读之后的议题。那这些呢也是奠定了我们读书会非常稳定的一个基础。那我们的美英师姐她在线上。我们的线上美英好，欢迎欢迎美英师姐。美英师姐现在因为疫情大部分时间都待在家里。可是呢，她在家里越是没有出来，越是帮忙我们可以做更多的事情。真的很感恩他。那我记得有一次读书会我们大家就是想说，读书会完以后，我们应该要有一点分享。那结果呢，没有题目。后来美英师姐她就出了2个题目，大家都很欢喜，因为她出的题目都很简单，可是却是非常的入法。我们的音乐出来了吗？我们的 video。它是一个没有影像的声音而已。那美英师姐你在线上吗？你要不要稍微跟大家分享一下？
梅尔师姐好，各位师兄师姐好。
好，请讲，很好。
听得见呢？
非常好。
也非常感恩Mary 师姐这个非常的用心带领我们这个品书会他呢就是看到他这么用心呢，所以说呢他说需要不同的同大家一起来互相完成这个品书会呢，所以呢他就请我担任串场。那我呢也就义不容辞的接受了，希望呢我们能够聆听上人的开示呢，大家一起呢更能够了解。那我就不好意思呢就不自量力的承担了。那在承担的过程也是要准备，在准备的当中呢让我学习的更多。我进入慈济呢，也是因为听到上人的开示呢，才进入的。所以说呢，这个读书会能听上人讲法呢，是非常的重要。那么在当中呢，我也学习到呢，这些题目呢，也都是就是说要比较简单的。那我就会问我自己说，是怎么样子，然后呢，出一些简单的，让大家呢能够了解。很感恩 Mary 师姐给我这个机会因为呢我们也知道万般皆下品，唯有读书高。那尤其是公文佛法呢 更是不同的境界。希望我们每一个人来到人生的当中呢，让我们的生命能够更有色彩，大家都能够改命转运，走向更好的菩萨道上，我们大家一起携手向前行。感恩跟祝福每位师兄师姐，希望你们都能够邀约亲朋好友一起来参加我们的品书会，让我们的人品能够更高更宽阔。感恩祝福大家，谢谢您的聆听。
非常感恩我们美英啊，其实我们的站长还有一位竹君师姐哈，竹君师姐还有她的师兄范爸爸，大家都知道，他是20多年来我们的医疗志工，不离不弃。那当我们需要什么的时候，他们都是买一送一的协助我们。那他们的是这个尤其是范爸爸，他是我们的音控的这个前辈。那他们培育出来我们薛丽儿师姐，薛丽儿师姐要不要跟大家分享一下？我们的薛丽儿她现在在忙着音控哈，她说她从完全不会学到会，然后现在真的是非常的棒啊。当然我们还有一位幕后的廖师兄，他也是他的导师。影像出来了吗？
在7、8个月前，读书会开始启动。那当时给邀约在7、8个月前，读书会开始启动。对墨学来讲，那是一个当时给邀约任务。心想书会操作音控这么多的医师，对墨学来讲，那是一个不可能的任务。还是菜鸟，还在新法乡这么多的医师云来一起，就是怕当书会啊，自己还是菜鸟，还在有很多负面的想法，就是本来想要拒绝的，可是喊那的。那有很多负面的想法，勇于承担，本来想要拒绝的，可是做就对了。所以呢，讲起上做中觉，觉中学，勇于承担。有了这几句话，那我就鼓起勇气了，硬着头皮来承担这个做中觉，觉中学。有了这几句话，那我就鼓起勇气了，硬着头皮来承担这个自以为不可能的在练习，在练习，在练习，到懂这几个月的时间。每次轮到默学操作的时候，不断的在练习，在练习。在这上面听不到声音，每次轮到默学操作的时候，或者整个从大家中断的时候，在这上面听不到声音，导师看不到画面，或者整个师兄中断的时候，还好，然后2位。每次的廖师兄都很顺利圆满，马上在更加鼓位，然后让听的各位师兄师姐的品书会都很谅解以报，顺利圆满，还更加感激现在线上聆听的各位师兄师姐们的随时都可以接受变化球然后把每次的现在品书会的流程还可以读者的 PPT 文稿分享者的变化球要分享的，把每次的文稿或者是哪一天上人开文稿分享者的事前要分享排好在档案里面文稿或者是哪一天上人开示的影片都要事前的去承担了排好在档案里面。还有呢，那个现在已经那个品书会里面每次操作承担了。还有呢，那个那个品书会里面说明是导读操作，然后呢从只会看本书本不懂的里面说明也不懂也不了解，然后呢从现在听得会看本书本中的不懂的里面真的是受益不懂也不了解从现在听得出书中的含义，那真的是受益良多，感恩。
Mary 师姐，轮到我讲话了吗？好，那我就开始了哈。各位师兄，各位师姐，不知道是不是音控啊？这个地方呢，稍微有一点点，开启视讯了哈，不用了，我们就这样就好了哈。那不知道呢，是不是的话，稍微有一点点联系主席，请你开始视讯。对不起哈，我的视讯稍微有点问题，所以呢，视讯就先不要好吗？啊，开启。OK， 这样可以听得到吗？好，这上面呢我都写得很清楚。
我们听得很清楚。
我是杜和义哈。好，感恩。上人，还有呢，金色师父，各位师兄、各位师姐、各位大医王，大家在这个时候呢，应该是 good afternoon 了哈，大家午安。我叫做杜和义，我的法号呢是本净。我进到慈济来呢，从会员一直到现在，前后加起来应该是快40年了。感恩 Mary 师姐呢，给我这个机会呢来分享。分享什么？分享我喜欢呢读书会啊。下一章。进了慈济呢，当初我进了慈济的时候，我很认真做慈济，但是我做的呢并不怎么快乐，因为呢自己的脾气暴躁。其实也不是说怎么样暴躁了，我也不会说很暴躁，但是呢，就是把外面的习性呢，把它带进来，所以呢，看这个也不满意，看那个也不满意，所以呢，认真做，结果呢，做的功德全部呢都漏失了，我自己呢，真的也起了一个很大的烦恼。于是，我的资深的师姐呢，她说呢，你这样子的话呢，倒不如你去参加读书会，去了解上人的法。我的资深师姐呢就跟我说，进慈济门不用慈济法，必生烦恼。好，下一章。下一章。因此的话呢，好，那所以呢，我就参加了呢读书会。前面一章。因此我就参加了读书会，因此我从37道品呢一直读下来，37度道品，还有呢法譬如水，还有呢8大人觉经，以及呢2006年出版的无量易经等等，我就开始读。我读了他们以后呢，我深深的忏悔，我才了解呢师兄师姐呢是如何与大家配合做慈济。原来大家了解上人法义之后，大家呢从书本上了解上人法义以后呢，他们的身段呢都很柔软，他们的态度呢都很谦卑，而且呢乐于配合。下一章。也就是呢参加我深入学习呢师父的法以后，我认为这一点对我的启示非常的大。从读书会上面呢，我真的非常的体认，这个时候我才知道人缘重于理缘，而且呢，你要理缘之后的话呢，你才好事缘。这一句话呢，一直呢放在我的心里头，所以我才知道我是应该要配合。而且呢，别人所做的呢，在我们慈济里头所做的有他们的道理，你有你的好方法，但是不见得是每一个人互相配合的方法。所以呢，我才知道我要人缘重于理缘，理缘之后呢，才好事缘。自从呢，我从读书会上面我了解到了这样的一个道理了以后，因此我就乐于配合了。下一章。没有下一章，好， 英控，请下一张。对不起，因为我没有留稿，我的稿呢就在我的桌面上面了。哦，所以我刚刚没有用分享画面，是吧？好，应该是前一张了，前一张。啊，那所以呢，因为这样子，自从我了解这个以后，所以呢，我都这样做。我也鼓励呢大家呢，刚进来的，不管呢你懂不懂，你是怎么样，你是个博士是怎么样的，只要是你来参加慈济的，你一定要参加读书会。所以我说我爱慈济读书会，尤其现在美国的医疗置业，我们现在的美国医疗置业，就我们现在呢这个节目了哈，有成立一个州市医疗读书会，读的呢是净思法随妙莲华续品第一。我们呢常常呢都能够在课文上品闻上人的法义，所以我非常鼓励呢我们的大医王或者呢师兄或者是师姐、医疗志工啊，或者说你很热心的，都能够拨空来参与呢我们这一个州市医疗读书会，我们呢都能够共襄盛举，读上人的法，让我们来了解我们应该是如何配合别人，配合师兄师姐来做慈济。请下一张。好，那么呢，我读了呢州市医疗读书会的续品当中啊，我们呢已经呢读了一本，第一册已经读完了。我在这个地方跟大家分享续品第一呢，课文的第253页。这是我最喜欢的一句话。之前的时候呢，我喜欢的一句座右铭是用《六祖坛经》里头的，他说：“不思善，不思恶。”你这一个时候，你的心态是怎么样一个心态呢？不思善，不思恶，任我时您的心态为何？这是六祖坛经的话。但是这一句话呢，是一个文言文，非常的拗口。自从我读了253页这一句话以后呢，我把我的座右铭呢，用上人的这一句话把它给取代了。来，音控，我们看下一页。这一页是什么说？上人说，无论是你喜欢就是为思善，思想的思，善事做善事哈，慈善的善。不喜欢的事，那么就是呢思恶，你不思恶，都要能够及时从你的内心清除，你不要去想它，不思善不思恶，你不要去想它，让你的心不受外界的染污。各位师兄各位师姐，你们看看这一句话跟六祖坛经不是不谋而合吗？所以呢，你看多么的轻巧，我们呢跟大家分享的时候就这样想出来，多白话。所以我喜欢上人的书，从上人的书呢启发我如何来做慈济，启发了我如何让我的心呢能够永远的内心清楚。所以下一章，无论是欢喜不欢喜的事，你一定呢要把它赶快去除，让你心保持清净。感恩，请大家多来读上人的书，这是我最后的结语。把这一句话呢，我也用了将近有30年。用上人的法解释上人的话，用上人的话解释上人的法，这样我们才能够彼此一起呢，来合心合气做慈济。在我们的续品第一的513页，上人有讲过一句话：当我们大家合心合气做慈济的时候，那么你都可以得到天人的护持呢。所以我们大家一起来读上人的书，我们才能够知道怎么样跟人家配合，我们的努力方向、用功方向才能够一致，才能够呢让我们大家呢都有很好的智慧产生，修到很好的福报。感恩大家，谢谢大家，希望大家多来参加我们的医疗读书会，非常感恩。交给音控的，谢谢您。
在
都没有声音哎。
听不到声音呢，
没有声音，然后画面也 freeze。
在慈济世界里，情与诚充满在人与人之间，陪伴与关怀是一代一代慈济人的默契与智慧。回想默学多年来在慈济路上有很多的善知识导引我，给我更多的力量和信心。因此，当医疗品书会邀约默学，便义不容辞参与。虽然这一套净思法随妙莲华续品在社区读书会已经攻读，但有机会再深入经藏，有机会能够陪伴与关怀美国医疗置业的医护人员及志工同仁，深感幸有荣焉。大医王与医疗志工秉持人伤我痛，人苦我悲，费尽心思减轻病人的痛苦。默学多次参与社区义诊及国际义诊，深深赞叹并感同身受。医疗之爱如同阳光雨露，带给病人温暖和希望。非常赞叹以及感恩医疗品书会团队用心耕耘，严谨安排，不只邀约学佛有心得的讲师导读，更有资深慈济人的分享，事理印证彰显佛法的妙用。静思语说，人生若能被人需要，能拥有一份功能为人付出，就是最幸福的人生。借由品书会，每个人起了诚意和恭敬心，做每一件事就自然很欢喜，达到菩萨实地的菩萨欢喜地。无论做什么事，只要能保持欢喜心，即如同身处佛菩萨的境界，道心清净，为利益众生而迈进。再度感恩有这么好的因缘陪伴医疗品书会，与其说是练习陪伴，实际上获得最多的是自己。祝福每一位菩萨家人福慧双修，善念时时生，慧命日日增。
好，感恩啊！我们接下来呢，在我们的凤凰城那边有一位韩丹医师啊，韩丹医师，你要不要分享一下？韩丹医师，
你好 ，Mary 师姐，听得到吗？
可以，请讲。
谢谢。我那个，我就是很感恩 Mary 师姐的邀请啦。我参加读书会收获不小，从一开始有一点烦恼心，因为我们学医的很多课程要听，在网上有很多的课程，医学的讨论啊，学习病案啊什么，还有跟各类专家学习我就有一点烦恼心，说我凤凰城周日也有读书会，我还要另外再参加这个医疗读书会，是不是太多了？ 后来Mary 师姐不断的邀请我，我都不好意思啊，就想哎呀听听看吧。好，一听呢，我就觉得哎呀，真的是很感恩 Mary 师姐，因为你的用心和坚持哈，然后我才来听，我才能闻到你们这个总会这个读书会这么好，大家这么用心，还有导读都是非常棒，我就很感恩，很心念一转哈，就很欢喜了，就觉得真的是收获不少，所以我也愿意分享这样子。那我在从读书会，那我真的学到很多哈。我觉得我们做医生呢，我们是治人的病，那人的心病，我们还是要用上人的法来治。所以我觉得上人就是大医王，他是治众生的病，我们只是治身体的病，所以心灵的病要靠法来滋润，来清理我们心里的污垢。所以我很感恩上人给我们这么好的带领，建立我们这么好的一个慈济的清新的一个世界，能够就是能够在人间建立一个清净的一个净土。所以我是觉得大家都来做慈济大家不断的影响身边的人，家里的人和身边的朋友，那这个社会就会更美好。好，感恩。
好，非常感恩韩医师啊，他在1个多月、2个月前，他就一直跟我讲，我好期待每一个星期四的品书会，他真的给我们很多的鼓励。那我们接下来呢，是不是可以请我们的如金师姐，她是从拉斯维加斯过来，那 video 有没有 stand by 了？
各位家人好，我是郑如金，我是一个朝9晚5的上班族，因此我没有机会晨钟起熏法香，也没有机会赶上一日之计在于晨的读书会。所以当我听说有一个下午班的医疗读书会品书会，我真的很高兴，这个真的是我们上班族的福利，而且星期四下午就变成我1个礼拜当中最快乐的时光。我住在拉斯维加斯，我们拉斯维加斯是从2014年开始入监狱传佛法，这要很大的勇气，因为我们都还没有机会好好的参加品书会，所以大家都很害怕，都不敢去，所以总会就有一个师兄就说了，如果如今师姐敢去，你们大家都可以去这是一个褒奖，表示我勇气可嘉。可是我也不愿意老是做一个负面教材我也应该要成长，应该要学习所以这个对我而言是一个很好的机会。以前呢，我们总是准备一些近思语还有我们的实际影片去跟狱友分享。但是现在我听了好多师兄师姐的导读法义分享我觉得我心里有好多的感动，想要跟别人分享。我已经累积了很多故事，迫不及待等疫情过后，我们可以再回去监狱的时候，我就有好多的法，好多上人说的故事、道理、佛法，去跟在监狱里受苦的许多人跟他们分享。再来呢，我也是一个真善美志工。我们常常被告知，写文章不要表面文章你要写出文章的深度跟广度。但是因为这个限制，让我们更加的绑手绑脚，有时候更不好发挥。很高兴呢，有一次我们听到上人对四无碍辩才的一个告示，我从而得知，原来此无碍就是不管这世界上有多少种族，有多少不一样的语言，但是佛陀他讲的法，我们用各种语言去表达，只要我们走的方向对了，道理对了，那就是对了。那同理呢，我们写文章的时候，做报道的时候，也不一定要引经据典，也不一定要说很多的佛法， 跟很多的道理，只要我们找到相关的故事，然后彰显出我们慈济人所做的事，还有我们的精神，那大家都收到讯息了，也都懂了，也都认同了。所以欢迎大家来参加我们下午的品书会，读书的孩子不会变坏，欢迎大家下午见，周四下午品书会见，感恩。
非常感恩如金师姐你可以感受到从品书得到他的那一份法喜。那我们接下来呢，要邀请我们的班长他最幸福的就是要邀请大家来导读。那我听听看你的这个甘苦谈2分钟。
感恩Mary师姐还有那个师兄机会真的是是他们从台湾就是看了刚刚大家都讲过了看到台湾在遍地开花，所以读书会。那刚开始的时候，其实我自己也是很没有信心但是还是很感恩我们的核心团队就在我们这边在做的就算是司仪然后那个师兄还有冰凤还有很多很多师兄师姐在后面的护持那我除了就是说当班长之外呢，后来也是有开始就是在导读那真的是大家刚刚可以看得出来我的中文程度跟在旁边的真的是差很多但是我听到有一句话就是说要开始不是要很厉害才开始，要开始才会很厉害那所以呢，就是因为这句话就是给我一些鼓励那刚开始的时候呢，人数也不是很多啦，从10几位20几位。那最也不是幸福的地方呢，就是有的时候呢，很多人其实也是不太有信心跟我一样那但是我就是拿刚刚那句话出来跟大家讲，那说我也是新生那所以大家可以一起来进步那也很感恩有一些资深的师兄师姐一直的在评论那有一些新的呢，他们也是开始慢慢的勇于来承担那真的是非常感恩大家也是就是给我这个机会那有的时候非常也是很感恩那个葛师兄跟Mary师姐那时候刚开始的时候，他们在台湾就是每个礼拜因为找不到人，所以每个礼拜他们都是会来负责导读一次。那如果说有的时候他们就是在水师网路不稳他们都一定都会录音那真的是让我非常感动的地方还有杜医师那时候也是在台湾刚刚杜和医师，那我都还没有见过他，但是呢他也是就是说真的是非常的谦卑，非常的配合。如果我突然说杜医师不好意思，下个礼拜的人不能导读了，不会来帮忙一下他都是义不容辞还有我们的邓医师也是一样。那分享人也是有的时候也是很难找那也是非常感恩我们的小葛师兄还有慈师师姐也是常常的都是来就是说来救我抚慰一下那真的是非常非常感恩那现在我们有差不多50位上下左右的人来参与那真的是很感恩大家护持。那刚刚也听到他们的分享那真的是像如金师姐真的是进步非常非常的多应该是现在是有更多的机会让他发挥那真的非常感恩大家聆听。
对，刚刚我们Dr. Lina 有提到我们有一个这个医疗的董事他叫做小葛师兄其实呢他这次他其实是一路来非常护持我们医疗，那可是他说机会让给别人，所以他就在下面聆听我们大家的分享。那我们在线上其实80%的都是我们读书会的成员因为时间不够了。那我们你看到我们的总务 Jason 他今天也坐在这里，我们可不可以来听听他的这个一点心得分享？有录音，你有录音。
作为一个医疗的同仁我觉得很幸运。
再大声一点。
在这个我们基金会董事长跟葛师兄跟Mary师姐的促成下，在医疗有一个品书会， 就是每个礼拜四下午。那因为我的身份同仁的身份比较特殊，有时候要跑来跑去很多事情，有时候忙，所以不能说每一场都能参加到。但是只要我能参加到的，我可以说是用戒慎恐慌，或者说戒慎虔诚来讲说，自己真的是太不坚信啊。这个评书会有时候我上去听的话，大家都很踊跃的在发言，然后可能有的人还抢不到发言的机会，那我个人是觉得是自己没有很尊敬，所以也不敢发言啊，所以只能静静的吸收这些精华精髓，让我自己能够在这个菩萨道上能够增长慧命。感恩
杰森啊，记得以后每个星期四 stand by 哈。他说他在家里读的时候，他的家人都会顺便看，所以呢，非常感恩你帮我们传播。那我们接下来呢，我们这个读书会还有一个特色，就是我们有一个单元，就是让我们的年轻人啊，那我们陈俊就是我们这个年轻人的这个窗口。那Kevin 可不可以跟大家分享一下？Kevin 也在线上吗？他我们每个月都有一次20分钟时间给我们年轻人。那我们已经有好多位的年轻人在过去这么多月来包括他自己。那我们有一个年轻的代表叫做 Clarence 在音控，要不要跟大家挥挥手？他也有一些话要跟大家分享。我们的影带Clarence 在上面，等一下你们会看到他会主持圆圆。好，那我们的影带好了吗？
参加读书会是一个非常殊胜的因缘，为什么呢？因为我们可以借这个机会去认识到很多师兄师姐在不同的职业、不同的工作当中，他们是怎么把佛法运用到他们自己的生活和工作当中，甚至是和家人们的相处当中。那我认为呢，我自己作为医疗基金会的同仁，能够参加这个读书会呢，是非常感到感恩的，因为我可以认识到很多不同的师兄师姐，也从他们的分享当中领悟到，其实佛法就是应该实施于生活当中，实施于自己的工作当中这样子。
好，非常感恩 Clarence 那我们接下来呢，我们这个评书会当然最重要的我们的执行长我不知道我们执行长现在还有没有？他在台湾，你在睡觉还是？好，我们好像是不是也有影片？我有点忘记。好，邓医师。
敬爱的上人、金色师父、全球的人医会家人们，大家好。今天要跟大家分享医疗读书会。那医疗读书会呢，主要是为了医疗人员而设定的一个平台。我们也称它做医疗品书会。对于大多数的医疗人员来说呢，真的是也只能够品因为大多数的医疗人员呢，忙于工作，所以大家没有太多的时间呢来读。我们透过导读者的解释跟分享呢，就很容易让医疗的人员呢有机会更深入佛法，那把佛法呢用在生活上。想当初我自己呢，也是因为做医疗而进入慈济，只是希望说可以服务更多的病人。在那个时候呢，我记得就是因为有杨师姐带领了一群医师们呢，办了一个小小的读书会，也因为有这个机会呢，我才能够进一步的学习佛法。那在那个时候呢，我也有机会可以提出各式各样子的问题来讨论。那当葛医师呢，在一次的接医疗基金会执行长的时候呢，他就推动了医疗基金会的读书会，让我们呢医疗人员呢还有职工们呢有更多的机会来学习佛法，深入经藏。 那医疗的读书会呢，和组队的读书会是比较不一样的。主要的原因呢，是因为医疗读书会啊是针对医疗人员量身打造的，所以呢更容易被医疗人员们呢所接受。从每一个人的分享中呢，我觉得有很多人呢可能是没有机会接触过佛法的，或者是读过佛经的。那有一些参与者呢，他们也并非是医疗人员，但是同样的都可以透过这个平台呢来学习佛法。我更要感恩呢所有医疗读书会中里的这一些资深的师兄师姐们，因为呢他们来带动来分享、鼓励跟陪伴大家呢一起学习佛法。那这一群的师兄师姐们呢，已经深入经藏很多年。那他们也是从读到品，不过呢，同样都是在品书大家所得不同像我们比较之前的呢，那品的这个味道呢，可能就跟资深的师兄师姐们所品的呢是不太一样的。不过呢，也因为有这样子的品书会，那这个品书会呢就会变得更多元化也是非常的有趣欢迎大家呢一起来参与，感恩大家。
好，感恩我们执行长邓医师他在台湾现在还熬夜陪伴我们。那在葛师兄最后结语之前，我要邀请我们有一个最重要的灵魂人物，美娟师姐。美娟师姐呢，她是每次把我们做的事情都帮我们包装的很棒。那我们美娟师姐来，自己拿椅子，好。
我知道时间已经快来不及了，那我就长话短说。虽然说做了一个 PPT 那重点是呢，我们还是可以放一下 PPT 好吗？感恩。对，美娟师姐希望有八爪鱼可是八只手，可是没有办法，现在只有2只手，没关系，在这边拍，在这边。好，我要坐在葛师兄旁边坐正。是 OK， 那今天我还是要站着好讲比较好。对，我今天要跟大家讲的题目呢是那个小手机传大爱。为什么说小手机传大爱呢？下一章。那其实呢，这个 PPT 呢是跟大家是借用我们文发处的 Nancy 师姐的这个 PPT 然后在上一章，不好意思，上一章，对不起。大家知道我们的那个网站有几言几语吗？答对的，我可以请大家喝 cappuccino。好。快，我们的网站有几言几语，来，我们的 Rosie 师姐，来，几语
，4
languages，
Chinese, English, Chinese, and Chinese, English, Chinese, and
2 Chinese, right？为什么我说是3言4语 ？OK， 中文、英文、西语，那里有2个中文，对不对？一个是繁体中文，一个是简体中文。OK， 那下一章看答案出来了那我请你喝半杯，因为你答对了一半，感恩。然后呢，下一章麻烦，不见了然后呢，我们的网站是有3言4语，这个都是同事非常精心去做的。所有的讯息呢，都会在这个网站上。下一章麻烦。
下一章。
那个 computer freeze 了，我的速度太快了，没办法。OK， 那我就继续讲了。那另外呢，为什么我们要有小手机传大爱呢？我们所有的活动，我知道各位师兄师姐，你们为什么这么年轻？就是因为呢。我们有太多的活动了，让大家不止身体健康、脑力健康，然后呢手脚又很灵活。所以呢，我们在所有的网站上，我们都会把我们的所有活动、慈济医疗的活动，还有那个慈济基金会的那个活动、慈善基金会的活动，都在我们的网站上、影片上会有。另外，大家看到了这个活动要怎么样呢？要报名参加，报名参加是很重要的，因为你要身体动、手动、脚动 ，OK？ 那怎么样报名参加呢？我们就有几个管道。第一个， 你不时有时都会收到我们最伟大的这个 Mary 师姐，她的动作非常快，她跑的速度也非常快，真的没有人可以赶得上她哈。然后呢，那她都会，然后呢发 LINE 的讯息给大家，然后呢，我想追她，我也发，我也跟着发，然后呢，那大家就会跟着传。那为什么要转传？那另外我们会在 Facebook 上会 post。Facebook 上 post 呢，大家看到 Facebook， 然后看到很多你照的照片啦，像万师兄，对不对？每天煮好那个菜，然后还有那个频道，对不对？我们要做的一件事情是什么？动动你的手指头，我们要 like 一个大拇指，然后呢，我们要转发 share， 我们还要什么？写评语，对呀，你就给他一个大心，好不好？这样子呢，你那个 post 才可以一直是在上面的 ，OK， 不会被压到下面，不会被压到下面，好不好 ？OK， 这是第一个。在这个之前，你要先做什么样的动作？你要先成为我们 Facebook 的粉丝哦，可以往下走哦，它还在上面。好，没关系，我继续讲，大家就继续看 ，OK。那另外哦，这个好，这个就是我要讲到重点。这个是什么呢？这是我们健康讲座。大家知道我们慈济医疗每个月会有2次健康讲座，是哪2次啊？在什么日期？猜到的有一杯 cappuccino。哎，我好像考试这样不太好，大家就想说我赶快要圆的。哎，我们的慈济师姐来。
先告诉你，我不喝咖啡没关系，你不用担心。一个是在每个月的最后一个礼拜4，英文，对不对？另外一个是在每个月的第2个星期六早上，当然是中文。
好，不喝咖啡，请吃冰淇淋哈！太棒了，太棒了！那这个呢？这个讲座，我们接下来这个英文的讲座就是9月25号。我有请我们的贝斯师姐叫我站在中间哈。然后呢，那9月11号我们中文讲座已经站在讲台上，不好意思。然后呢，下一张，所以大家千万不要错过。那这个刚才就是我讲的 Facebook 这边，大家看到没有？有 like， 有 share， 有 comment。好，下面一张麻烦。这个大拇指千万不要忘记哦。再下一张麻烦。另外呢，我们不只有 Facebook， 我们不只有 Line， 我们还有我们的 YouTube channel。那 YouTube channel 大家看到没有？我们就有 Tima 在上面。现在我们就是在转播我们的 Tima program， 就 live 的这个部分。然后另外呢，我们英文的健康讲座，我们现场转播之后呢，我们都会放在这个上面这个 playlist 上面。所有讲英文的人，想要听英文频道的人都可以在这边找到。那想要听中文的人，就是慈济医疗健康讲座，都会看到我们所有的 video。大家不要忘记要做什么事情。还有呢？哇！好，继续下一张。好，这个就是大家看到我们的所有的 video， 这就是你看我们做的美轮美奂，这个也是我们的志工 Joyce 师姐一直这样子带领着我们，然后我们 Mary 师姐拼命的转发。你知道我们现在冲到多少人吗？接下来我要请大家吃什么呢？我请大家吃万师兄煮的东西。万师兄，你觉得我们现在冲到多少人了
？6000多。健康素质组到你家，有的版本已经超过1-2万了。
哇，那我们要扛拜，那这个是我们的目标哦。那我们是不是下个礼拜就可以冲到2万？有没有这个信心？有，太好了 ，OK， 感恩。然后下一张麻烦。所以呢，每一个这个 video 我们都会写 description。我们为什么要写 description 呢？因为大家可以温故而知新，大家可以知道我们这个健康讲座大家都在讲些什么东西，然后呢不会浪费大家的时间。所以这个是我们，而且呢还有一个很重要的一点，就是我们会有 hashtag， 我们会把重要的 keyword 放在上面，所以全世界的人想要找我们的健康讲座，他找 keyword 就会找到我。OK， 这是非常非常棒的。然后我自己夸自己哈，对不起，然后在下一页还有夸我们的志工。那如何能够帮助别人，还有帮助自己，我们就讲到重点了。我们在这个9月11号，我们张医师跟大家分享，在讲如何这个要有好脑力哦，防止这个失忆症。下一张麻烦。第一个他说要多参加社交活动，我把它改成多参加慈济的活动，因为我永远都猜不出来师兄师姐们你们的年纪 ，OK， 你们都是非常年轻力壮的。然后呢，多动动你的手指头 ，OK， 要 like share 还有 comment。第三个就是我们的师兄这边很棒的月捐计划，我这边一定要写哦，因为我坐在葛师兄旁边，就是月捐启动。OK， 好，我已经被讲要赶快时间了哈。这边是我们的月捐的网站，大家一定要上去，不管捐多少钱，这个都是帮助自己、帮助别人。这也是为什么我们可以在海地做这么多的事情的部分。OK， 所以月捐活动 ，OK， 感恩您，谢谢，谢谢。
好，非常感恩呢，大家有没有觉得这个读书会每一个成员都有一个很重要的特质？这个特质呢，就是那个热忱非常的大。那之所以有热忱，就是用心。所以我觉得在慈济世界里面，上人不是说多用心吗？就是如果我们能够把这个热忱用心散播出去，大家就会喜欢。所以我相信参加我们的读书会啊，下一个就是欢喜。我用8个字来总结，就是用心而且欢喜。那我还记得有一次我问邓医师啊，我说你的手语怎么会变得那么柔啊？我都学不来。他说其实我很笨拙，之所以能够让你感觉到我很熟啊，是因为我勤能补拙。所以就跟大家讲，其实修行佛法也是一样的，要渐进的、循序渐进的过程。所以8个字：用心欢喜，循序渐进，就是我们的秘诀。所以祝福大家修行佛法呢，这个法入心，法入行，跟随着上人走就对了。谢谢，感恩。
我们看圆圆啊，圆圆的手语完了之后，我们会有感恩的时刻。那感恩我们在现场所有功能组的成员，如果是叫到你的组别的话，麻烦你们也来让我们全球的人医成员感恩你们一下啊，谢谢。
好，感恩慈禧师姑，感恩记者世博哈，在这边跟大家分享我们品书会。那品书会真的希望大家可以踊跃参与啊，因为真的是一个难得的机会啊。那每一次我们里面呢都有记者世博哈的分享导读啊，真的是非常感恩大家的承担。好，那我们接下来是圆圆的部分，所以呢我们请接下来会有手语的带动，那我们先请我们的手语队准备哈。那在准备的时候呢，因为是我们圆圆的节目哈，请大家一起我们先来问讯。那师兄师姐们请起立，请合掌，向佛菩萨及上人行三问讯礼，问讯。再问讯，三问讯。好，感恩大家，请坐。好，接下来由我们手语队的带动，请手语队，感恩请音控， 好，请音控菩萨帮忙播放，感恩。
多少汗水砌成一道墙，多少苦心聚成一个家。这里是温暖明亮、阳光眷恋的地方。一个人一点微薄力量，一条心。多经历就能点亮，多难的愿望，让我们像一家人一样，来分享感动，化解迷惘，用最温柔的目光。彼此成长，张开臂膀，打开门窗，让爱照在心上。也许你我故事不一样，却都在这被爱被疗伤。这里是谈心歌唱，阳光眷恋的地方。一个人一点微薄力量，一条心。感
感我们的手语团队哦，真的非常非常棒的一个手语表演。那当然哈，在人艺会这个呈现啊，也不是一人能做哈，真的是需要一个很强大的团队。在这边呢，想感恩哈我们这次总协组、客户组以及我们核心关怀组。那其实哈，在这边呢，真的再次要感恩我们的慈禧师姑哈。那师姑真的行动力非常的快让我们呢组成这个团队在短短几个星期里面就安排了这些课程。所以在这边呢，真的很感恩我们这3个功能组的团队，感恩大家。好，那接下来呢，那当然是不仅仅只有这3个团队哈，那接下来呢也有我们媒体组哈，媒体组呢有它非常重要的角色。那这里面呢也包含我们的如金师姑包含我们一凡师兄哈。阿慧师兄等等哈，真的是很多人，还有 Brother Henry 哈，Sister Suli 哈，那感恩你们一起来帮我们这个忙哦，因为其实在线上播放，大家觉得可能点一点很简单哦，其实它是非常困难。那在这边呢也是很感恩我们总协调的部分哈茉莉师姐刚才大家可能都已经很熟悉哈，茉莉真的非常有经验那感恩你们这几个星期来的努力。那接下来呢，当然还有我们的香鸡部分哈。那香鸡呢大家有吃有喝的时候呢，当然心情也会比较好吧。那所以呢感恩我们这个生活组哈，还有我们香鸡组的菩萨们。好，那接下来呢，也当然有我们的队服组哈，每一个营队呢，最主要真的就是我们队服们。那我听很多学员分享今天真的是很感恩队服组哈，一起来帮忙。那不仅仅是在有一些 Zoom 的情况下，或者是学员有问题都及时帮我们解决。那在 LINE 群组上面也是真的不断的帮我们来做这样子去帮助这些 LINE 这些 Zoom 的 connection 好，感恩我们的队服组。好，那接下来呢？下一页好，还有我们的翻译组。那翻译组呢，真的非常的重要哈。我们这次呢有从英翻中，中翻英，也有我们的西语的这个团队哈。那这样子的话呢，我们真的可以把整体的 Tima 分享给我们整个美洲，感恩我们的翻译谱。好，那当然就是少不了我们的手语组哈。那手语组真的非常的棒哈。刚才我们有看到我们手语组的表演，那这3天呢，大家都应该有站起来跟我们手语组一起手语组的带动一起来比一比。那手语组呢真的是很快几个星期里面把这些都练习出来，这样子呈现真的非常的不容易。在这边呢也是感恩我们的手语组。好，那接下来呢，我们会请到我们各核心区的一些分享者。那今天我们第一位呢，会请到 Dr. Stephanie 王，是我们西北核心区。那 Dr. Stephanie 王，请。
Hi, can you hear me?
Yes, we can.
Okay. I feel so blessed to attend Tima conference all those years, especially this year during the pandemic. The program is very well planned and carried out with different sectors well covered. We was able to learn and chat with Tima family around the world in the cloud with no border. Today, in my dental group, first, Dr. Wang tell us about power function of jaw and spring therapy, which really demonstrate the vision of integrating multiple disciplines with dentistry to achieve the best treatment for the long-term benefits for patients. And second part, maxillofacial surgery. I'm a dentist and also a mom of otopharyngeologist. I still can't pronounce it well, my son's profession. Anyway, he's an ENT doctor, okay? I am further convinced how closely related the dental and the medical, although the slides may be a little bit gross or graphic to some people. And third, Dr. Yan presents the cracked tooth symptom. The diagnosis and treatment are always challenging and tricky through my career. Yeah, I'm sure I'm still miss a lot of good points. And also, just now, the 医疗品书会 is really tentative. Okay, then yesterday, the presentation from Taiwan and branches around the world about the pandemic remind me that a saying, say, people can be divided into 3 classes. The few who make things happen, the many who watch things happen, and the overwhelming majority who have no idea what has happened. I believe Tzu Chi family is the people make things happen. Not only with make things happen and make it with love and care. Thank you for my sharing.
Great, thank you. Thank you, Dr. Wang. Next presenter, we have Sister Angela from Seattle. Just aware about Sister Angela, she accompanies many of the teachings, and I've got to know Sister Angela relatively well over the years. And many of you may have seen her previous courses on vegetarianism. And trust me, her actual cooking is phenomenal also. So Sister Angela, please.
Thank you, Kevin. 嗨，敬爱的上人，金色常住师父，全球家人菩萨们，法安。Oh, brother, sister, good afternoon, or good morning, or good evening. My name is Angela Wan. My Dharma name is Li Zhi. I am the medical team leader of the Seattle branch of the USA in Northwest region. I feel so gratefully to participate in the global 25th anniversary medical annual conference. I have heard and seen all those wonderful sharing from all regions around the world in these 3 days. It's really rewarding, and my heart is full of gratitude and blessing. Seattle is the city on the fringe of the Northwest USA. The Chinese live in scattered area in Seattle and are not like California or New York. The Chinese community are more connected. Therefore, during the pandemic periods in year 2020, the Seattle medical team can only do PPE and mask distribution. Our main distributor are hospital, rehabilitation, nursing home, senior apartment, homeless shelter, and some supermarkets. Since March of the 2020 until December, and this year, 2021, in February, March, and August, we all do the PPE and mask distribution. And on this year, July 6, 2021, Seattle branch hosts a COVID-19 vaccination pop-up clinic. Seattle Tima group partnered with ICHS, International Community Health Service, at the outside of Seattle branch office front door. ICHS is a community clinic at the Chinatown. They have a 4 clinic around the Seattle area. And on July 7th, they provide medical staff, and we have a COVID-19 Pfizer vaccine for 12 age and up, and Johnson & Johnson for 18 years age up. There is a people show up from neighborhood and the people from Taiwan too. And there is some 12 years old young kid accompanied by their parents. So this is our only pop-up clinic in our Seattle office. And since the pandemic break up on March 2020, we starting to do vegetarian promotion, vegetarian meal that is good for our health, for the wellness of our world, and also a blessing toward resolving the COVID-19. So no number is too small. A day, a meal, a week, a month, or even one vegan meal a day can make a difference. So please also share this information with all your friends and families. As you know, our CEO of the medical mission, Dr. Lin Junlong, as he say, vegetarian is really, really good for your health. And we hold vegetarian charity food sale many times from March last year on and off until this year, August. That's last month. We continue to promote vegetarian diet to encourage people to eat more vegetarian. So a leverage of social media to keep promoting vegetarian since it's established in early May 2020 until now. There are more than 19,000 friends from all over the world have joined. So we really hope everybody can become a vegetarian. And I'm so thankful to have this opportunity to do my sharing in this wonderful event. And thank you very much.
Thank you, Angela Sugo. Thank you so much for your sharing. Always great to see you and have you as part of Tima this year. Next up, we have a person that many of you probably already know, and that is Sister Carol Liu. Carol has been an avid volunteer for us for many years and continues to help not only a clinic and also, if you recall, during the pandemic, our COVID hotline. So thank you very much for all of your contributions. And please, Sister Carol, we'd love to hear your sharing.
And good morning, all the Tzu Chi and Tima brothers, sisters all over the world. I'm Carol Liu, I'm the nurse, and I'd like to share with you for 3 topics that I have learned for this past 2 days. First, I'd like to talk about this. If you all can remember this little girl that sitting on the step with the eyes look so helpless in Malaysia. After that, after the 17, the date that I come home, when I close my eye, I always see this little girl's face. If you still remember, to think about her right leg, there's not much muscles left on the right lower leg. I was thinking, this poor little girl, how can she walk? If she couldn't walk, how could she crawl on the floor? I'm just thinking, also I'm thinking how much suffering this little girl has been bearing all her life since we don't know when that happened. And she was even worse, she was left with her 2 siblings to stay with his grandpa. This grandpa is the main source of the income for that big family, the 3 siblings of the little girl, plus the cousins, plus uncle, the auntie. The only work that grandpa can do is picking up the things that can be resell or can be used from the trash, other people's trash, how much money she can make. But I am so happy, I'm so glad that Malaysia's Tima team find these girls. And let's pray for these girls. I'm sure these girls from that moment, she'll be in good hands. And I would like to ask all the sister brothers, let's pray for their little girls. Maybe, hopefully, by next year, that in our Tima team, we can follow up on these girls, and we hope that her life can back to the normalcy at that time. My next impressive talk I'd like to say is regarding the pandemic. And the Tzu Medical Center in Taiwan, I think it's the Taipei, they did now the medicine is based on the evidence-based practice. So this is a rarely seen study, although it's a small number of the participants. But however, it's very meaningful. They did a study on the vegetarian, how being vegetarian affecting your COVID, the illness, the severity of illness. So this study, they found the patient, if they are on the vegetarian diet, they can the disease process, the progression, the severity will be reduced. It's reduced compared to the regular diet. Although it's a small study, I think it's a very eye-opening. So far, there's no study that talks about COVID. Of this study, we all know vegetarians is good for our health, is reducing your cholesterol level, reducing your improve your diabetes. Multi-center study comes out, and that will be a very hard proof that vegetarian does improve your I would say your immunity. The other thing I'd like to talk about is this new concept in Taipei Tzu Medical Center, the hospital. This is the first time I heard about this. For the quarantine, the people that will be quarantined, they put them in the hotel. But however, the Tzu doctors, the medical team, not just the doctors and nurses, they all incorporate all this administration team and also include the community sources like police department and other the medical supply equipment company. They all work together. They have a well-planned standard operation system from the moment that the people step into this hotel. How they're going to be, for those quarantine times, how they'll be monitored, they'll be assessed, and how the police department can follow up if someone, they lost a contact, how to come back. And also, this is a proof, say, if all the whole system, if not just a medical institute, they can work together with the community resources, then we can have a good control of the COVID. That's the proof from the Taiwan, the status there. We are short of, we don't have enough supply of a vaccine. However, we did have a Delta variant happening there. But with that, not enough supply, but we're still able to have this pandemic well controlled. As now we are getting better and better. And one more thing, the Tzu Chi University, they come up with this. The university they work with the Taiwanese the Central Studies Research Institute. They come with a new PCR testing kit. Isn't that incredible? They're even more sensitive than the other commercially available on the market. So this is a very exciting. We have some heartbreaking story, but we do also have some very encouraging, exciting things happening in Taiwan. So this is make me so happy to be in this Tima convention. I do learn a lot, and I appreciate the chance that I have this opportunity to join the Tima. Thank you.
Thank you very much, Sister Carol. Appreciate your sharing. And obviously, we really appreciate all of the work that you put in for the Medical Foundation, for Tima, and for the General Tzu Chi Medical Mission. Next up, I think many of you probably already know her. She's from Chicago. And the first time I met her, I made sure that I had to pronounce the name properly. And that is Ma Yue. And please join me and welcome Ma Yue for her sharing. Please go ahead.
Hi everyone. 亲爱的上人金舍师父 all the doctors and nurses, 师姑师伯师兄姐 hello everyone. My name is Ma Yue and I'm from Chicago. Thank you for having me and I'm really grateful for being here sharing with everyone. Actually, I didn't know I signed up for this retreat until the last minute. Someone signed up for me, but it's okay. I'm really grateful that Shigu helped me sign up for this. And I really learned a lot from this retreat. The most, I think, I forgot her English name is Chen Wenqian. That's her Chinese name. She shared something about climate change. I really like it because she said we are so small as the human being. No matter if you are a big city or you were a big city like in the 19th century, when the flood coming, like the Ida comes to Louisiana, New York, and I'm sure everyone saw the news. So all the cities, the people are so small. We don't have any, more time right now, and what kind of thing we can do. And I remember Yao Renlu Sibo, he also shared when the disaster come, and there are 3 kinds of people in the world. One kind is we have to hide right now, and we have to gather some resource and be prepared for the disaster. And the second kind is we have to go help people. and the third kind of people is, oh, there's this disaster. I don't know, there's this kind of thing, you know. So we also call them 贪嗔痴慢疑的痴. So Master teach us to 转识成智. So I'm not sure how to translate that, sorry. As a human, we always talk about the climate change, but we don't have any actions at all. When we go back to that three kind of people, what kind of people do we want to be? The first one, second one, or the third one? I believe all the Tzu Chi volunteers, we always be the second kind of people, right? We know right now the only way we can change the climate change is being vegetarian. And so actually this medical retreat reminds me of going back to the 2018, I went to Mexico, and I'm really happy to see a lot of familiar faces in this retreat. There are a lot of doctors and 师姑师伯 were with me in Mexico. But when I was in Mexico, it's not a touching story, it's a funny story. I wasn't a vegetarian back then, and I got bit by the mosquitoes very bad because I wasn't a vegetarian. So if you don't want to get bit by mosquitoes, you can be vegetarian. So that's one of the solution, okay? So being vegetarian, is that really hard? If you think that's really hard, you can go to Tzu Chi. I believe a lot of volunteers, they're willing to share their recipes. They can guide you step by step. And there's a picture that the Yao Renlu Shibo, he showed us. There's a little cow. I think he knows that he's going to die, and the faces and his eyes are so, I don't know, it's so hard to look like that kind of pictures, right? So if you're not vegetarian yet, you can start something like small. You don't have to be vegetarian like right now. You can just start from like 1 meal a week or 1 meal a day. It's very simple. If you can do it, just go to Tzu Chi. They will fit you very well. Okay. So yeah, and so we need to do more than just taking care of ourselves. We need to take care of the society, not just care about our own, I don't know, 安身立命。我们要做超过自己更多安身立命的事情。So that's my notes. I don't know how to translate that. We don't just live for ourselves. Master teach us 甘愿做欢喜受 and 付出无所求. So be willing to give, be willing to bear, and also giving without ask anything for return. And I think if more people having that kind of value in their heart, I believe climate change will be much better right now. So that'll be all for my sharing today, and thank you all for your time. 感恩。
感恩马月师姐 Thank you, Sister Maria. Always great to hear your sharing. Next up, we have Brother Huang to share. Brother Huang, please go ahead. Hello, Brother Huang, are you there? Okay, well, because of timing, let's move on first. That concludes half of our shares for this portion of our closing ceremony. Let's take some moment here and watch what has happened over the past couple of days. We've prepared a short video for you, which our media group will help you play at this point. Please join us and watch this video, and then we'll continue on with the shares for the afternoon set, for the later session.
Break the close borders, Dr. Doctors come from everywhere to build a world of love, where the sun will never set, where the flows forever, selfless and without regret. Every doctor is a light, shining hope and love on those in need.
I pledge with all my heart that my destiny is serving mankind.
Serving mankind.
I gratefully respect the great teachers who showed me the way. With respect and with reason, I will do all I can to save those who are ill. With all of my heart, I'll uphold the great oath passed on to us.
When someone needs our hands, we will climb over the steepest mountain. When someone needs our care, we will sail across the widest ocean.
Follow Master's compassion, and a world full of pain will become a world of hope. I will give it my all. May our white gowns be like beacons of light.
Let us safeguard light and love. Let compassion fill this world, to build a world of love, where the sun will never set, our devotion never dies, selfless and without regret. Every doctor is a light, shining hope and love on those in need. When someone needs our hands, we will climb over the steepest mountain. Steepest mountain. When someone needs our care, we will sail across the widest ocean. Widest ocean. Follow Master's compassion, and a world full of pain will become a world of hope. I will give it my all. May our white gowns be like beacons of light. These sufferings with great love for all, and learn to treat with humanity. Wondrous doctors, wondrous skills, spirit clear and calm, love flows forever, selfless and without regret. Every doctor is a light, shining hope and love found those things need.
好，感恩大家哈。那for the past several days, I want to thank all of our staff members again. It was an amazing amount of work that was put into all of the efforts. So we're going to continue on for our afternoon sharing before our actual closing here. And is Brother Juan online? Thank you.
Mute.
Hear us?
Hi, Brother Huang. I think we do not hear your voice. There's no sound from our end.
Sorry, Brother Juan, I don't think we can hear you right now. Would you be able to take a look? We'll have one of our media team reach out to you to solve the problem. But in the meantime, let's move on to our next speaker, which is from Las Vegas. Las Vegas being obviously a really interesting area, and we're moving forward to look for establishing a local dental outreach program there, as well as vision. So very excited for the opportunities going forward. Let's at this time welcome Brother Daniel Wang for his sharing. Brother Daniel, please go ahead.
Hey everybody, I just want to say firsthand what an honor and pleasure it's been to share along with all of our doctors and medical professionals and volunteers and friends this wonderful presentation weekend, hearing about all the cool things and wonderful things that our brothers and sisters are doing all around the country and around the globe. It's always such an inspiration seeing what wonderful projects are going on. And this year, especially in spite of COVID and all the difficulties the world has faced, it's so inspirational to see that Tzu is still trucking on, solving problems from the world one step at a time. On the local level, on our medical mission, we've been in the dental outreach clinic game for a few years now, but we are just now starting to expand into our vision outreach and hoping to dabble in medical in this upcoming year. And just seeing this weekend how far we have to go. And then I know the road looks really tough for us right now, but just seeing all of the other chapters in other countries, the Tzu chapters there, holding them up as a model of success that we can aspire to, that we can dream big and hope we can achieve that same level of success one day. It's just so inspirational seeing how well organized and coordinated all those efforts are, how well thought out those procedures and protocols are, and just seeing some of the things that we might be able to implement here in our local chapter. I think the most inspirational thing for me is just seeing, for instance, the hospitals, the Tzu branded hospitals that they have overseas and the wonderful facilities that they have there. I know there's all sorts of political and legal realities and hurdles to try and get a similar kind of thing set up in the States. But it's great to hear about the FQHCs that we have going on in California. And hopefully one day in the not so distant future, Las Vegas can partake in that program as well. I was inspired on the first day, especially seeing all of the care that our medical professionals are taking in treating COVID. And I know here in Las Vegas, probably in all across the US and across the world, we've kind of rolled up shop because of COVID, but hopefully seeing the advancements that the world has made in preventive measures and PPE and how to be safe around COVID. Hopefully we can step back out into the world and start doing some more good. Tzu is always very fond of that metaphor of planting the seed of doing good and cultivating bodhisattvas in the community. I'm hopeful that our efforts here and across the world are doing just that, starting with a little bit of good in the community, and hopefully that bit of good grows into great wonders. That's it. Thanks, guys. Great weekend. Happy Tima.
Thank you, Brother Daniel. And we're going to move on to the next sharer, which is Dr. Shirley Chen. A lot of the events and outreaches would not have happened initiating and certainly helping recruit volunteers. So without further ado.
Can you hear me well?
Yes, we can.
Okay. Thank you, Kevin, and thank you, brothers and sisters. Dear Master Cheng-Yen, Sifu aboard, and also all the brothers and sisters. I'm grateful to have the meeting this year. All over the 3 days, we had learned so much from Taiwan and Tima members all over the world. The topic itself this year is the pandemic. We heard so much touching stories from many medical professionals and frontline workers who are very dedicated and risk their lives to deal with the pandemic in the hospital and community. For the past days, I miss so much my dedicated Tima partners, Dr. Lin Huiru, Dr. Cai Zhongxian, and couples honorable doctors who have worked together outreach internationally. I'm also very touched to see the video when the BNT vaccines finally arrived in Taiwan after the month of the waiting, and people can finally get vaccinated in Taiwan. In the United States, our clinic were open, and many of our volunteers continuously serve the country communities as well by delivering PPEs and promoted vegetarian. And also, just like Daniel says, they are dream big, make it think big. We hopefully every chapter can make the dream come true. And last month, our Haiti family suffered disastrous earthquakes again. They are facing a widespread hunger due to the drought and the economic instabilities. With the love and care delivered at the headquarters by doing the medical kits from our volunteers to make everybody participant and bring the love to there. We all hope this pandemic can be over soon and can start resuming normal activities. I also sincerely followed the master teachings and last night, grasp the cause, grasp the opportunity, take stock of the meaning of the life. 昨天跟上人的晚上的对话，把握因缘，把握时机，盘点一下生命的意义 ，and continuously serve our communities. I hope next year we all can go back to Taiwan to attend the Tima convention with our lovely dear masters. Thank you all for everyone who helping out for this conventions. And thank you for letting me have the chance to share. 感恩。
Hello? Can you hear me?
Yes.
Oh, okay. Hi everyone. I'm Rui Yang. I'm in Boston now, and I'm in the graduate school in Boston University. I just came to US in August, so this is my first month here. I feel everything is really good, and I grew up in the Tzu Chi family. My mother joined and became a member of Tzu Chi when I was in junior high school. And since then, I started to learn the aphorisms of Master Zheng Yan, and I also go to the garbage collection with my mother, and when I go to the college, I joined the youth Tzu Chi club. So I made a lot of friends there, and now after years of working, and I want to share with you that my understanding of Master Zheng Yan's wisdom and become deeper, because I think when I was young, I cannot really know how other people really think of, but when I grow up and when I start to work, and I really feel that the Master Zheng Yan's wisdom can really be applied to my daily life. I can when I be with people and when I have an argument with other people or my colleague, I always think of his word. I always think of our Master's words, so I can calm my mind and return to a peaceful feeling. And now I'm in Boston, and through the Tzu Chi network, I get to know Sister Vicky in Boston, and then last week I was asked to join the interpreter team, and then I'm here today. I'm happy to meet all of you, and I hope I can give all my I hope I can share more with you in the future. Thank you all. Thank you all.
Thank you.
And this.
Thank you for your sharing. Thank you very much. Next up, I think a lot of times we rely on
lot of volunteers. Heartwarming to see our volunteers studying us. And I think that's what makes TT very much a family. And I want to introduce our next speaker, because the next speaker, Brother Martin Ko, is one that will stay to the very last minute to help not only with cleanup, setup, or at the same time accompanying us during our vaccine drive. He was there to the very, very last minute, and he was there very early in the morning as well. So certainly can't do it without our volunteers and can't do it without Brother Martin Ko. Please go ahead.
Hello, my dear families. So how are you doing this afternoon? My name is Martin, and such an honor standing here now to share with you how I feel. You know, serving with love and protecting others' life with risking their own life, to me, it was just a sentence. And then after these 2-3 days, Tima's classes, I can feel it, and I wept after I hear our superintendent, Chao, who's sharing about how we serve life. I think you feel that too. It's no longer it's just sentence. And to be a non-medical profession volunteers, I have such an honor to serve all our Tima members in many, many countries and in many, many services. Now I witness how these doctors serve tirelessly, just try to help more people. And also during the last years, we know all the outbreak of pandemic, and our people, our medical team fearlessly serve, and also through the effort from a former team and CEO like Sister Deborah, and also with Dr. K and the team, we achieve and recognize and certify as the FQHC members. So we are writing a history. Yes, us, Tzu Chi, our family, we are making the history. And also with all the effort, Dr. K, Mary, and all the team, we are enrich that page of history. Not only we keep serving, but also like we hear all the sharing today, 法路行. So they form a study group. So all these people, so again, hey, I was told it's only 2 minutes, so I'm already way exceed. So once again, it's an honor to be invited as the board members. Not only I witness how we are reach out on the higher level, try to serve more people in need, those family, they have no insurance. And we know for the next step, we're gonna serve more people who with medical, low income, we know how much they need it. So not only as a member of the board, I really pray and wish all this will be exceed. And then we need more volunteers and more Buddhas like yourself to join any need, because we know Tima is really helping people. And once again, I wish all the best to our team, and I wish the best that the whole world Tima will serving more people like our masters always teaching us. Again, so who sent me, so who I. That's what our goal is. And then for that, I'm such an honor once again to be part of this. Thank you very much and wish you all well. Thank you.
Thank you, Brother Martin. Thank you for your sharing. Next up, we have a few of our vice CEOs of our HQ region to share with us as part of our conclusion to today's event. Hello? Can you guys hear me?
我们那个 control room 是楼下的声音听得到吗？
Hello? Can everyone hear me? Hey, Dr. K. So next up, we have several of our vice CEOs, which will be sharing with us as part of our conclusion for today. First up, I would like to invite our board member as well as the Vice CEO of Tzu Chi Foundation US, Ms. Paulina Luan, please.
Kevin, can you hear me okay?
Yes, I can.
Good. Yeah. 敬爱的上人、金色师傅 all the Tima's members and brothers and sisters. Good morning, good afternoon, and good evening. I just wanted to take this moment to say I am very grateful to be part of Tima. The FQHC process over the last couple of years.
断断续续的。Paulina?
Can you hear me?
Yeah, we can hear you, but the voice is not very clear.
Sorry, I hardly can hear you.
Now it's better.
Now it's better. This way? Now, can you hear me okay now?
Yeah, very clear. Okay.
The FQHC process over the last couple of years, I have had opportunity the involvement to get a better understanding of what amazing and great thing Tima is trying to do. From the classes and sharing from this event, I learned just how much good Tima is doing all around the world, regardless of race and religion. During the pandemic, Tima sent out a PPE and food distribution, enjoying in frontline health in the hospitals and other medical facilities. They are doing exactly that title say, facing, talks about, which is a very important word, and doing it with love and care. Thanks, Tima, through all those years for providing dental, vision, flu shots, many classes for many students, supporting local community, and working with a charity and disaster relief projects. And myself, I got my second COVID vaccine in our Tzu Chi Medical Center. I respect and admire Tima's efforts and mission goals. I wish you the best and happy Moon Festival. May all of you stay safe and healthy. 感恩.
Thank you.
Thank you. Thank you to our Vice CEO and board member, Ms. Paulina Luan. Next up, we'd like to invite another one of our Vice CEOs of HQ for Tzu Chi Foundation, Ms. Deva Boudreau, please.
Okay, thank you, Kevin, and thank you, everybody. It's a very great honor to be able to participate 2021 Tima Convention. I'm going to share with you what we have. So may I have my first slide, please? Tzu Chi Foundation and Tzu Chi Medical Foundation, we started 1993. When yesterday I saw Dr. Chinong Lin, I'm so grateful. Without Dr. Lin, we would not have our medical mission in USA. So we started from free clinic. At that time, 1993 to 2000, we joined National Association of Free Clinic. Later on, because of the free is no more free, so the National Free Clinic Association added up another terminology called charitable clinic. So now we call NAFC, N-A-F-C. So Tzu Chi from Dr. Lin give us free clinic. We moved to NAFC. Then we have mobile. Then we have mobile healthcare association
also called coalition. From fixed location to mobile, this time we move into FQHC. Today, everybody talking about FQHC. From FQHC, what will be our next step? Tzu Chi is a faith-based organization. It's a community-based organization. It's an international non-government organizations. So where we are from? We are from Asian Pacific Islander American. So it's so important for us to be visible, to be part of Alpha Health Forum. So from the Health Forum, what will be our next? Dr. K have a chance to participate in NIH CO Community Engagement Alliances. That's so critical for us to be there. That's the way we need to go, to be part of our national project. From that directions, we need to work with HRSA, Health Resources and Services Administration. That's our dream, that's our goal. That's our Tzu Chi healthcare to all transitional paths. May I have my next slide, please? Now, from the clinical care, 1993, what will be our Tzu Chi patient-centered care? What will be our dream? What will be our goal? Let's think more beyond that. We're going to look into it. Home visit care. We are going to be getting older, and we are in the aging group. The young generation need to know how to work with the old generation. This kind of intergeneration care is so critical. From the home visit care, we're going to move into transitional care. Why? Because the current insurance care package, there's so many patients, clients, they will be discharged from the hospital and they have no capacity to go home for proper care. So the transitional care is one of Tzu Chi need to look into it. And the other dream from transitional care will be nursing home care. From nursing home care, we move into assisted living care, skilled nursing care, and finally, hospice care. Yesterday, when I see this time, we see so many foreign heroes, our medical providers, Dr. Zheng Guofan, Professor Yang Sibiao. In USA, we have Ding Huiru医师, Su Naizhen医师. We all going to be facing the final day. When we have the final day, that final moment, no matter you are 2 weeks, 30 days, 60 days, we need to have a very respect for life and gratitude to live. So hospice care, according to California, 2030, there will be 9 million require hospice care. From that direction, we need to think about Tzu Chi care, Tzu Chi village. That's our goal for 2030, and that's our dream. But no matter what kind of patient-centered care, you're talking about comprehensive, you're talking about accessibility, you're talking about facility. We only have one Mother Earth. How can we sustainable together? So every program have to be integrated with planet, people, prosperity, peace, partnership, and empower with love. That's what Master teaching us. So I'm very grateful today. From FQHC, from free clinic to FQHC. From this point, as a faith-based organization, as the interfaith leaders around the community. We need to find what will be the directions for all the Tzu Chi brothers and sisters, all the Tima members, and the supporters, where we want to set our goal and our dream. Thanks to Master, give us the opportunity to carry out the first medical mission in USA. This medical mission needs to be continue, move forward. Patient-centered care mission with gratitude, respect, and love. Thank you, everybody. Amitofo.
Thank you. Thank you, Sister Deborah, for your sharing, and certainly very inspiring. And we have a lot of opportunities in the Medical Foundation to develop further in many different ways in the United States. And here to discuss a little bit more about strategy, I would like to invite Dr. K to start us off. Dr. K, please.
My beloved Master Singer, Silver Master, Tima members, brother and sister, I feel very grateful to have all this team, Tima medical team. And first, I would like to thank sign language team. Please stand up and give a big applause. And also I feel very good. Thank you. And I also grateful for the supporting everyone, even on the back, and 3-in-1 team. Please give a round of applause. And also Xiangxi group, although they are very busy, give a round of applause. And I also feel very grateful. The 4-in-1 group, our volunteer group, allowed us use this place. Is it a wonderful place? I think it's a very, very beautiful place for us to do this event. And also, I want to thank all the Tima members in the United States, and also even some of them out of the United States. And thank you for your participation. Now is the time for future vision. We have a federal qualified health center status, and I should thank Sister Deborah painting the future for us. I think it's very beautiful future, beautiful pictures. But any end point we have to keep in mind, but we have 3 important focus we have to do. First one is manpower. We need to have more supporting manpower, no matter it's professional or non-professional, and enroll all the talents we need. So as long as we can enroll a lot of talent people around us in Tima, we can achieve a lot. So one is manpower, another one is money, finance. And recently we are going to have a year-end fundraising. I hope everyone can join in to support us to reach our mission this year. At least this year there are so many disaster, hurricane, no matter it's a nature disaster, man-made disaster, it's coming one by one, and we need money to support our mission. So the second focus is money, the finance. The third focus is the power of our mind, the will we have. And as you know, a big oak tree is coming from one small seed. And the seed is the love, the power of love, the power of man willing. So as long as we have the will, we can achieve the goal eventually. So I urge you to come together to make a dream, a big dream, and also implement the dreams with us. And thank you very much. Thank you. And I hope next year we are seeing everyone in Hualien, Taiwan. Thank you.
Thank you, Dr. K. Thank you for your wonderful sharing.
We are going to share a sign language all together, like one family. And everyone come to the stage. Come to the stage. We are going to share everyone online on cloud. Is the whole United States, even whole world. We have a lot of people over here, and to say hello in the end and say goodbye in the end with one family.
Great, thank you, Dr. K. For all of you online, please feel free to join us at as part of the sign language performance. As you know, one family is quite a tradition for Tzu Chi and Tzu Chi events. When I first saw videos of one family, and I thought, wow, these are really good recordings. There are hundreds of people standing up and doing this together. And guess what? I went to Mexico. Literally, there are hundreds of people standing up and doing the sign language with us. So it's a very moving piece, and many of you already know it. So please join us as part of the final remarks of our Tima 2021 closing ceremony. Let's welcome the sign language team.
I feel happy when you laugh cheerfully, and when you are crying, I hurt even more deeply. For my dreams to come true, I will need your company. Your love makes my courage grow strong within me. Together, we share life joyfully, because we are one family. We're together, so grateful you're with me, because we are one family. We're together, we share life joyfully. when you laugh cheerfully, and when you are crying, I hurt even more deeply. For my dreams to come true, I will need your company. Your love makes my courage grow strong within me. Because we are one family, we're together, so grateful you're with me. Because we are one family, we're together, we share life joyfully. Because we are one family, we're together, so grateful you're with me. Because we are one family, we're together, we share life joyfully. Because we are one family, we're together, so grateful you're with me. Because we are one family, we're together and share lives joyfully.
Well, thank you everyone for joining us for Tima 2021. This concludes our 3-day session, and we look forward to seeing you all next year. And at this point, we pray to hope that the pandemic will be behind us by this time next year. And as part of our closing ceremony, we would like to invite everybody to please rise. Please put your palms together. We'll pay respect to Buddha and Master. First bow. Second bow. Third bow. Thank you very much to all of our brothers and sisters online. Thank you for all of our team members that made this possible. We have had a wonderful Tima 2021, and we couldn't do it without you. We hope you enjoyed the 3-day session as well, and we will sign off here today and see you next year. Thank you. Thank you, everyone.
Thank you, everyone.
Thank you.
Have a nice weekend.
Thank you.
Yes, thank you.
Thank you, everybody. Thank you so much.
Thank you.
Thank
you.
Keep safe.
会霞，会霞，
感恩，感恩，
感恩，
爱你，爱你，爱你们哦！
感恩大家，辛苦了，
感恩
幸福了，
幸福了，
幸福，
大家幸福了。
Hi Jennifer。Ecuador Jennifer。
辛苦了，感恩，很棒的营队。拜拜，拜拜。